Welcome back to the Wicked Psychology live stream of the Maya Kowalski case. Real quick, the overarching story is that she's a young girl who had been taken by Johns Hopkins All Children's Hospital. She was suffering from complex regional pain syndrome, CRPS, and she was initially receiving ketamine infusion therapy for her condition. However, when she was brought into the hospital, the situation escalated due to a misunderstanding of her condition and treatment by the hospital staff. She was then held against her will away from her parents due to concerns of Munchausen by proxy. One thing that I wanted to discuss before we get started is one thing that I find interesting is the hospital is denying that Maya had CRPS, right? And yet they billed for that condition. And the billing rate for that condition is significantly higher than anything else that would need that kind of medication or therapy. And it's interesting because since they're denying her CRPS, then they have to accept that it was billing fraud, right? So the prosecution at some point pushes for billing fraud to make the hospital have to accept one of the two evils, whether it was billing fraud and they accept that, or they accept that, yes, she did have CRPS and that they were in the wrong. As we know, the hospital doesn't want to be in the wrong at all. So it's interesting to see how that plays into this trial with them denying both and simply saying that similar conditions could constitute needing similar therapies and medication as CRPS. All right, so we are going to get started today with Maya's father, and then we're going to also see a bit of Maya's testimony in addition to a social services person as well. All right, let's get started.
To clarify,
Yes,
again, on October 11th, you were at a meeting where the doctors told you the time frame of how long they wanted Maya to stay, correct?
I don't know the time frame.
Well, you told the doctors after they told you on October 11th they wanted to keep Maya, you said that's doable, correct?
There was some argument there, so
Well, you were upset when you found out that conversation with you giving consent on October 11th to stay was not documented in the record, true?
I'm getting confused here now. Say that question again, please.
After you gave your consent at this meeting for Maya to stay at All Children's on October 11th, when All Children's told you the plan of how long they wanted there, and you said that's doable, when you found out that conversation of you giving consent wasn't in the record, you were upset by that, true?
Objection, compound. Overruled. Big.
I was upset or Beata upset? I didn't understand what
The conversation where you gave consent to stay on October 11th, you were upset that conversation of your consent wasn't recorded in the record on October 11th, true?
I don't know if it was the consent. What was I talking about earlier? That was not. It was about being arrested. That was not in the report. That's what I said before.
Your Honor, I'd like to play for impeachment clip one of the audio.
When I replied to
I don't think so
her,
at this time.
Okay.
it was in reference to being arrested.
Sir, there was nothing. Let me ask you this. Do you remember when you sat down for an interview with Detective Graham?
I do not. Oh, Detective Graham? Yes, I do.
On that interview with Detective Graham was on November 17th, 2016, correct?
I would have to look at the date,
Okay.
but somewhere in that area.
I'll represent to you.
Okay.
It was, and Detective Graham was one of the investigators with Sarasota County, correct?
I'm aware of her.
Okay. Do you recall having a conversation with Detective Graham where she asked you about whether you were supportive of keeping Maya at the hospital?
I would have to see that, but there was something I'm supportive of getting Maya better. I remember, yes.
Okay. Well, did you not tell Detective Graham that you were at a meeting with the doctors one day and Beata wanted to take Maya out, sign her out, and you said, hold on, time out?
Objection. This is reading in the sustained.
Okay. Do you remember telling Detective Graham that you were in support of Maya staying at the hospital as of
Objection.
October?
Same thing. They overruled on that one.
Yeah, I'm unaware of that, to be honest with you, but I know things were talked about, but I do not recall that part.
Well, let me just ask you this while the jury's here. Are you disputing that you gave consent for Maya to stay in the hospital on October 11th after having a conversation with the medical doctors where you told them that's doable? Are you disputing that?
Like I said, sir, that we were under certain things we had to follow. I do not recall that part.
Okay. You're not disputing, are you, that on October 11th that you gave consent for Maya
I'm
to
not
stay?
saying yes or no.
Objection, let's ask and answer the third time.
You can finish, Mr. Kowalski, your answer.
Yeah, that I'm unaware right now. I'm sorry.
Well, even as of November 17th, 2016, you were receptive to keeping Maya at all children's. True?
She was under state custody at that time, and then we refused the transport because of the coding.
Wasn't my question to you, sir. Even after state custody, on November 17th, 2016, you were receptive to keeping Maya at all children's hospital.
Do you
True?
have something to show me to help back that up? I don't know where you're going with this.
Okay, I'd be happy to play that
Yeah,
for
please.
you, sir. Clip 4, please. Well, sorry.
Wait a second. Are you asked, is this for refreshing the recollection? 'Cause if so, just show him the transcript.
Which depot was this from?
This is, I didn't ask for
Okay.
There's 5 depots, so
no,
which one?
this is from your interview with Detective.
Oh, okay. That's what it says there.
Well, I understand that's what it says, sir. It's true, though, is it not?
Well, I can't. It's there, so.
Respectfully, Mr. Kowalski, you told Detective Graham while Maya was sheltered at All Children's Hospital that you were receptive to keeping there even as of November, true?
That's what it says, but that interview was extremely, very, very difficult to get through. She was, you heard the tape.
Did you didn't
Hang on,
lie?
let him finish, please.
Sorry, go ahead, sir.
Finish.
I was under a lot of stress. I didn't know where she was going with that. You know, but I do not recall that, but that's what's in the writing. I must have said it, yes.
Okay. So what's clear to this jury, you admit that you told Detective Graham on November 17th, 2016, that you were receptive, even at that point, to keeping Maya at All Children's. You're not disputing that, are you?
I'm not
That's
disputing.
irrelevant. The
On-
decision already been made. I move to strike.
Overruled.
Let me ask you about some of the bills that you were asked about.
Yes,
When did you first review the bills from All Children's?
the bills would have been after Beata's death, I would imagine.
Okay.
Because she's the one that handled the bills.
So just to be clear, the bills that you reviewed from All Children's that your counsel walked you through, you would have reviewed after your wife's death, true?
Yes, I didn't, it was, I had no idea where she kept all that, and it took some time.
Okay. At the time you reviewed them, did you believe the CRPS codes were true and accurate?
On the billing,
Yes.
it's state CRPS on there.
Let me ask you a little bit more about that. In Clay, it's Joint Exhibit 2017-663. You might be able to enlarge it for us.
Thank you.
Okay. This bill that you were shown, you see that the services rendered included for endoscopy, true?
Yes.
They included for nutrition.
Yes.
There are, by my count, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 diagnoses codes that were submitted as part of this bill. True?
Yes.
Among those were CRPS and child neglect or abandonment, among others. True?
I see that.
Sir, can you tell this jury what percentage of the $5,980 was paid for CRPS?
I don't see where the percentage would be.
Well, it doesn't say it.
Okay.
And I'm not trying to trap you, but the allegation that all children's billed solely for CRPS treatment, that's not what that says on this bill.
When that question was given to me, I believe he asked what was if that diagnosis was on there, or what do you see on top?
Okay. All Children's Hospital was paid for the bed while your daughter was being sheltered there. Are you aware of that?
The bed? You said?
Correct.
Objection, that's irrelevant on that point.
Sustained.
Okay. Are you aware, sir? Can you tell this jury at all what percentage of the $5,980 Aetna reimbursed was for child neglect versus complex regional pain syndrome versus a throat infection versus immunoglobulin versus constipation versus abdominal pain, etc.?
That I could not.
You can take that down, Clay. No one at All Children's Hospital ever told you that Sally Smith was an employee of All Children's, true?
No, and nobody told me that she wasn't.
All Children's never told you that Sally Smith was their employee, correct?
No, but she was wearing the same lab coat.
I'm asking you, so that's a no, correct?
I said no.
Okay. And in fact, your wife knew who Sally Smith worked for, right?
I cannot speak for that.
One moment, please. We could do joint exhibit or trial exhibit 24081739. And it's in the about 2/3 of the way down the page. It says Tuesday, 10/11 Eve. I had another supersized visit. This was the email we showed earlier that Beata wrote to you. True?
Where does it say it went to me?
It says, do you want to see the date of the email again?
Please.
Okay, Clay, let's go to the first page, 1738. So I'll represent to you, this was...
Yeah, I see it.
Okay, so let's go to the next page, 24081739. Tuesday, 11 Eve. I had another supersized visit from MD Dr. Smith, who was sent by CPS to investigate this possible child and abuse and neglect case. That's what Beata wrote to you.
Okay.
Okay. Let me ask you about sir, and I apologize for having to raise this. You did have plans to have Beata move out, true?
Yes, that's true.
Okay. You had prepared divorce papers?
No. It was a legal separation.
Okay. You told Detective Graham that when Maya was released from the hospital, you would have Beata move out, true?
That was the plan.
And divorce papers were prepared.
We were going to do a legal separation.
I'm going to be as sensitive and brief as I can on this topic, sir. The hearing on Friday, it was Friday, January 6, 2017, right?
Yes.
That you talked earlier, Beata was very upset about being separated from Maya for now almost 3 months. True?
She was suffering. Anybody that would be removed from their daughter would be like that.
Okay. The 3-month separation of Maya from Beata was what was causing her this emotional heartache. True?
Most of it.
That night, you do recall Beata left with a gun. True?
That was my thought, but that was untrue after time.
Okay. You reported to the police that night that Beata had left with your gun.
I reported Beata missing and potentially, well, I said the gun's missing out of the safe, but it was in the house.
You did not believe she was suicidal that night, did you?
I was very worried about Beata. I called her family, but I was concerned when the gun was missing, but it ended up finding the gun in a long time after. She never took the gun.
But on that night of December 6th, you were not concerned that Beata was an immediate suicide risk, were you?
I was concerned that she was missing. I was concerned about her health. I called her family after she was denied in court. Her brother did fly in, but she did come home.
So that's a no. You were not worried about an immediate
I was
suicide.
worried about her. I told you I was always worried about
I
her.
wasn't asking if you were worried about your wife, sir, respectfully. I was asking if you were worried that she was at imminent risk of suicide.
Well, when I didn't find a gun, I was very concerned, and I called the police right away.
Beata never expressed suicidal ideation to you at any time. True?
She never mentioned suicide whatsoever.
And then the next day, which would be the 7th, now Saturday, January 7th, I think you said you and Kyle had gone out to a party. Is that right?
We went to a neighbor's house, a birthday party. Beata was going to go with. She had a migraine headache. That was the day after she was missing, and she came home that night. She stated she had a migraine headache. She was in bed. She did get up to wrap the present for the child. We went to the birthday party, and when we came home, the door was closed where she was sleeping. So Kyle and I, sat on the couch. We watched TV. Kyle fell asleep on the couch, and then I shut the TV off and went into my bed. At that time, she was sleeping with Kyle. That was like her little security blanket. That's all she had was that little guy. So that night, her brother, like I said, I called because I was concerned about her.
And so just to make sure I understand the question, when you came back, you didn't check on her because you did not think she was suicidal at that moment, did you?
No, she stated she had a migraine before we left, and I let her sleep.
Okay. So, and again, just so the jury understands, at no point during this process did you believe that your wife was at imminent risk of suicide. True?
I was always concerned about her.
I'm
But
not
yes,
asking you for
it's
consent.
true. I was always concerned about that.
It's-
With all that was going on, yes.
but Beata never expressed any suicidal ideation to you in November, December, or January. True?
November, December, January. There was a report from the hospital that she, in your records or in Sally Smith's records, that somebody within the medical.
Sir, I'm asking you about report to you.
Hang on, can you please be allowed to answer the question you're asking?
It's non-responsive to my question. My question is very simple.
I agree. So why don't you ask your next question?
Okay. My question to you, sir, was this. Did Beata ever express any suicidal ideation to you in November 2016, December 2016, or January 2017?
She never told me that she was going to take her life verbally.
The jury earlier saw one of the suicide notes. Do you know why Beata said, I give rights of my parental rights of Maya and Kyle to my sister and brother in Chicago?
No, I do not know.
Let me ask you a little bit about Maya after she got out of All Children's. We had a chance to talk to, at least my partner, Mr. Hunter, did in November 2019 to give you an idea of time frame.
First depot.
Yes, sir.
Okay.
At that point, so now we are a little over 2 years after she got out of All Children's Hospital. Other than allergy medications, Maya was not on any medication, correct?
Not that I'm aware of. If I would have to review that.
Okay. She had not seen anyone for asthma in over 2 years. True, by that point?
That's true. And hopefully, like we said, ketamine and hopefully the hyperbaric chamber did help for that.
Okay. Well, to be clear, after she got out of All Children's Hospital in January of 2017, she's never received any ketamine, has she?
No.
And she's never gone to hyperbaric medicine, has she?
No.
In fact, as early as 2018, you were able to scuba dive with her.
She scuba dived, but with her arms.
Okay. Well, she was back in school the next following year.
Yes, on crutches.
And she became president of her class. True.
That is true.
She was waking up at 4 a.m. Running in the morning.
Running?
She was exercising
Not running,
at 4
she
a.m.
exercising.
Okay. She, as of that point, at least when you talked to my partner, Mr. Hunter, you did not see any signs of CRPS in her at that time. True?
At that time.
Okay. And again, when we talked to you in October of 2020, you saw no signs of CRPS in her at that time either. True?
No, but unfortunately there are signs now.
Okay. Well, let me ask you, Maya has been able to get a job working at Cracker Barrel?
She worked there. She waited tables and she had somebody carry the heavy load.
She got back to ice skating?
For a short time, yes.
She has no physical limitations right now. True?
I wouldn't say true. She knows her physical limitations.
She was back in phys ed class.
The what? I'm sorry.
Physical education class. She was able to get back into physical education class without restrictions. True?
True, but she had problems running.
And again, in that period of time, within 2 years after she left All Children's, from your observations as her father, you did not see any signs of CRPS, correct?
It never went away, just so you know. There was pain here and there. It's not like it was a clean slate. So I would say untrue on that.
Okay, well, let me ask you about that. When you were asked on November 6, 2019, what signs or symptoms do you see of CRPS in her today? You said, I don't see signs, no evident signs. She's not complaining of pain. Her muscles are built up. There's no lesions. I don't see nothing right now.
That is correct. And I don't know if you heard earlier, she hides a lot from telling me as well.
One moment, Your Honor. Just a couple more questions, sir. The
Famous.
yeah, true. The photographs that we saw earlier,
Yes.
of your daughter, Beata had not seen those before she died, correct?
I wouldn't say that's correct. She would have seen some of them, yes.
No, okay, so just to be very clear, the photographs that were taken, the date that Maya was being brought to court for the DCF dependency hearing, Beata had not seen those before she passed away, correct?
No, but she heard about it.
Well, you had not.
I have not seen them as well.
Okay. You had not seen the photos and she had not seen the photos, true?
Correct.
One moment. Those are the questions I have. Thank you, sir.
Thank you.
Redirect.
So those medical records had a lot of direct quotes in them, didn't they?
Medical.
The Johns Hopkins records?
Um,
They were trying to say what you were saying?
no, I mentioned that before. Yes.
And they kept bringing out what would be considered sort of negative information, right?
Objective to the leading, Your Honor.
Overruled.
Yes. And like I say, there was several things missing, such as lesions or dystonia, things like that.
Well, right. These are the same people who stopped documenting symptoms after a certain period of time. Is that right?
Objection, leading, and argument.
Sustained on that one.
What, if anything, did they do about those lesions and other symptoms after about, I don't know, October 13th or 14th?
They went from lesions to self-inflicting wounds.
So these same people have got all kinds of direct quotes, right? Isn't that true? And they've got a lot of assertions about where you did, what you did, right?
Objection, leading, and argument.
Right now, it's just a statement. I haven't heard a question, but it does sound a lot like leading.
Right. Well, let me ask you something, Jack. Through all of the records that you have seen back from TGH and back from Lurie's and back from the other doctors, did any of them put up a system of direct quotes and denials and you said this is, and they believe that?
Objection, leading, vague, and argument.
Did?
Yeah, I didn't understand the question, so I'm going to sustain on vagueness.
Was this the first time somebody had put into the medical records all of these types of allegations consistently against you?
Objection, again, vague, argumentative.
That one's overruled. You can answer that.
That all the hospitals did the same as
No,
what they did?
I'm asking you whether this was the first time, whether Johns Hopkins did. Was this the first hospital that had ever put all this kind of stuff into your record?
Oh, yes. Yeah, there's quite a bit of stuff in there.
So from this perspective, were you relying on them to be the treating physicians at this point? Is that right? Johns Hopkins was supposed to be treating your daughter.
Yes.
They were not supposed to be prosecuting your family, were they?
Objection, move to strike.
I'm going to overrule that question.
I'm sorry, say it again.
They were not supposed to be trying to prosecute your family.
Absolutely not, no.
All of this stuff, correct me if I'm wrong, all of these things they put in there were after they had taken the position with the outside world that Maya was making it up and Beata was essentially a criminal.
Objection.
Is that right?
Argumentative,
Sustained.
Wasn't this all after allegations of Munchausen by proxy and conversion disorder had been raised?
Same objection.
Overruled on that.
Yes.
So when you go through all of those records and compare them to the last hospital records, do you come away with the feeling that they were actually trying to help you, or build a case against you.
Objection leading.
Alternative. I didn't hear you ruling.
Sustained.
What, if anything, did it appear Johns Hopkins was trying to do in those records to you?
Objection. It's again argumentative. This states the evidence and lack of foundation calls for.
I'm overruling that one.
My feeling, they were painting a picture that we're doing something wrong.
And they were supposed to be your daughter's doctors?
Yes.
How many times in your life had you had doctors put all of these things in your records just randomly?
Objection, vague, and argumentative. That's all these things.
Sustained.
How many times prior to Johns Hopkins had any doctors consistently put negative after negative after negative, you said this, you said that, comments in your record?
Objection, same objection.
You can answer it this last time, but Mr. Anderson, you need to move on.
I'm about
You
to.
have more than amply made your point.
I understand.
So go ahead and answer it, and then we need to move on.
That's the first time.
So was Johns Hopkins, to your view, trying to get your daughter well and get you out of there?
Calls for speculation. Objection.
From his perspective.
You haven't finished the question, but it also sounded like it was going to be a compound question. So let's try to rephrase the question.
Did Johns Hopkins ever come to you at any point after they first told you on the 9th that you couldn't leave and tell you, it's okay now, you can leave?
That we could leave? No.
No, that you could leave.
Was there an objection?
No, Your Honor.
Okay. No.
And so were you operating under the assumption throughout this period of time that if you took your daughter, stepped out the door to get out of there, you would be either by security to the police or to the police end up in, well, custody?
Objection to leading, Your Honor.
Overruled on that one.
That's what we were worried about.
I want to talk for a moment about any statements to this Detective Graham. Let's take the jury to what happened there. So what's the first time you saw this detective?
I went to visit Maya for a visitation at the hospital. Mm-hmm. That was through Kathy Beatty at the time. I had to go through the hospital social worker for visitation. When I arrived, I went upstairs to get Maya, and she wanted to go down to the cafeteria to get a piece of cake or mashed potatoes. I don't recall what she wanted, but the door opened, and Kathy Beatty was there with a Sarasota County Sheriff's investigator, female.
Now, before this time, had you had any conversations with or involvement with the police over this?
With Graham, no.
So somebody called Graham to get her over there, from the best of your knowledge?
I'm sure it was coordinated because they knew exactly where I was.
And Ms. Beatty directed her up there, is that true?
They met us at the elevator doors downstairs.
All right. So you're there to see your daughter.
Yes.
Tell the jury what happened after that.
So they wanted to speak with me, and I advised them I was just going to feed Maya. So they allowed me to go have lunch with Maya. Then I brought Maya back upstairs, and I informed her I'll be back in a little bit. Well, it was a long time. Detective Graham brought me inside a room. And
hang on. When she brought you inside the room, was she armed, to the best of your knowledge?
I don't recall seeing a gun.
Did it turn out later she was?
I don't.
Objection, Your Honor. Speculation.
Sustained.
And so, did you know you were being recorded?
No, not at all.
She did not explain that to you?
No, she at one point she said she had to look out the window and pay her parking meter or something, and she reached in her purse. So obviously, maybe just changing the tape or whatever.
In her questioning, did she seem like she wanted you to testify against your wife?
Oh, yes, it was like a big wedge.
Mm-hmm.
Yep.
You ever heard of flipping a witness
Yes.
Objection, speculation.
or a suspect?
Overruled.
You ever
Yes.
heard of, and so her questioning in there, did she or did she not warn you before any of this questioning that if you weren't going to cooperate, if you aren't going to help, that you were going to spend time in jail?
Objection.
That's on the tape.
Leading and speculative.
Well, I'm going to sustain the leading, overrule on speculation.
What did she tell you about what was going to happen if you didn't turn on your wife?
She stated that she put other people in jail for many, many years and basically do the same thing to me.
So what was your choice here?
Cooperate.
And what happens if you didn't cooperate?
Object, speculation.
Overruled.
That I didn't know. That was scary.
Well, had she already told you she was going to?
Yes, yeah, that was burnt into me right away.
Well, your choices were what? To either testify against your wife or, from your perspective, go to jail?
Objection, argumentative, speculative.
And
Overruled.
you can answer.
Yes.
And so throughout this process, did she suggest, as we've heard, the answers to the questions in the question? You know what leading questions are. You've heard that here.
Yes.
In all of these things, did she suggest how you should answer in the question?
Yes. And then there was times where, just she had so much from the other side about all these high dosages and this drug is so dangerous. And, how dare, I don't know the exact words, so don't quote me on them, but it's basically how dare you for even doing what you did by going to Mexico, things like that.
Wait. She came in loaded with information from Johns Hopkins?
Yes.
Objection, leading, Your Honor.
Where, if any, if you're aware, I'll rephrase, where, to the best of your knowledge, would she get all of this information about your medical history?
Objection, speculation.
He knows.
Do you know?
I would assume that it came from the hospital.
I'm going to sustain the objection.
All right. Was there anyone else other than the hospital at that point who had all of that information?
No.
Logically, who was the only entity or person who could supply that information to the detective?
Objection, again, lack of foundation, speculation.
That's the predicate.
Sustained.
It was a predicate. Never mind. So, what did you think you had to do there in order to see Maya again?
I had to cooperate.
If you wanted to take your daughter home, what did you have to do?
Oh, this was something that was discussed with the attorneys. Like I stated earlier, I had an attorney. I don't know if it was at that time. I had an attorney, Beata had an attorney, and the children had an attorney.
So she questioned you without counsel. Were your attorney there when she was questioning you?
No.
Objection, again, to the leading.
Was you?
Overruled.
So can you tell the jury whether you were questioned without an attorney?
I was questioned without an attorney.
Did you have any help then in case she said inappropriate things to call her out on it?
No, not at all.
And so did she imply to you that if you weren't going to say yes to a lot of things, that you were going to have a great deal of problems down the road?
Yes,
And is that why you said the things you said?
I did, but then I defended myself on a lot of them. At the end, where she didn't record as well, going down the hallway, I said my wife would never do something like that.
So you told her that.
I did.
Didn't you tell her that on multiple occasions in
Yes.
that recording?
Yes.
And what did she do once you said that? Did she
Go to the next.
But wait, once you said that, did she relent and stop asking you leading questions, or did she continue trying to press you into saying negative things about
Just
your wife?
kept
Objection for leading the argument.
That's alternative.
And sustain the leading on that one.
Did she tell the jury what, if anything, she did in terms of accepting the fact that you had told her repeatedly that Beata would never do this?
that she just repeated the question again and again type thing.
On certain occasions, did she repeat the question on multiple times?
I don't know how many times or whatever, but some were, yes.
At the hospital, during the first part of the time you were there, when Sally Smith walked in, as you testified, in a white lab coat, were you relying on Johns Hopkins in terms of not letting people wander around their hospital with a lab coat on?
An objection for leading, Your Honor.
Sustained.
What, if anything, did you rely on the hospital for in terms of keeping people with a white lab coat and the emblem on it out of your daughter's room?
Objection to the relevance of the
Overruled.
legal conclusion.
What did I rely on?
No.
I'm sorry.
Did you rely on the hospital in that regard to keep people out?
Oh, yes.
And so did you start to discuss things with Dr. Smith thinking that she was another doctor there?
I didn't even know her name at that time. She never introduced herself. She just came in and just started asking questions. So, yes, I thought she was a doctor for Johns Hopkins because she came in alone. She was the only one in the room with Maya and I.
So no one introduced her?
No,
Did any hospital person correct that misassumption?
no.
And did you learn later that she was, in fact, closely aligned with the hospital?
Objection mischaracterizes the evidence.
Overruled on that one.
That she was in with the hospital? Yes.
So now, in this case, and you've been following it. Excuse me, strike it. How many times have you been deposed in this case?
5 times.
How many times has Maya been deposed?
5 times. Kyle won, I believe.
And you have stayed in touch with who are deposing and who are not deposing. You followed the case, in other words.
Yes.
And have you heard whether any psychologist or psychiatrist prior to Johns Hopkins on October 7th ever diagnosed Maya with some type of fictitious disorder?
No.
Prior to October 7th, did any psychiatrist or psychologist diagnose a Munchausen by proxy situation?
I never heard of that. No.
From your knowledge of CRPS, how unusual is it to have people at first question and consider these types of diagnoses, conversion disorder?
I wasn't really educated on that, but a lot of them are diagnosed with that, fictitious or conversion at first because they didn't get properly diagnosed with CRPS. But in Maya's instance, she was diagnosed with CRPS, after Tampa General.
You've been asked on several occasions whether during certain times, particularly, I think October 11th, on October 11th, then, how many days was it until the state actually entered an order to take your daughter? Was it on the 14th?
The 13th, I was told to leave.
So by October 11th, you were pretty much through with your week there?
Yes.
And so when Beata started to, let me put it this way, was your wife shy about stating her opinion to the Johns Hopkins doctor?
No.
And were you concerned that if Beata continued to press them, they would keep Maya longer?
My personal feeling, yes.
And so, in terms of approach, did you try to present a more relaxed and not quite as intense approach than your wife?
Yes.
Now, by was it your impression, based on everything that happened to you, that the reason for your losing your daughter was because of the use of ketamine? Losing your daughter to the state was because of the use of ketamine?
Yes.
So after you got her back, tell the jury just how interested you were in trying ketamine anymore.
Well, I was instructed not to, but we've seen great results with it. And
So continue.
there's times, we wish we were able to get her treated, and now I'm seeing her, getting a little downhill here. So I'm very concerned.
But have you remained concerned that if it gets out to another doctor that maybe doesn't know you as well, that something might happen?
Sure. Absolutely.
And from your knowledge, and how old are you now?
62.
Sorry, Dad.
But I feel like 80 after today.
But has it been your experience that once something gets into your medical records, it tends to stay in your
It's
medical
stuck
records?
there. Yeah.
And throughout this period of time, then, did it appear to you that Johns Hopkins had prejudged you?
Objection
and your wife?
grounds for legal conclusion
Prejudged.
and speculation.
I can rephrase.
Yeah, prejudge, I don't understand that.
Got it.
Sustained.
Well, in reviewing the records to Tampa General, did you read where Johns Hopkins had sent over a, if you will, transfer report?
Did Tampa General send one over?
No. Did Johns Hopkins send one over to Tampa General to start this out?
We went from Lurie's to Tampa General.
I got it.
Okay.
But do you know if...
That I would be unaware of. That would have been Beata.
Fair enough. All right. So Maya tried quite a number of her old activities as she got a little better.
Yes.
Did they last?
Some.
And why didn't they last?
It was too much pain.
And what happens? What about memories of her mom? Strike it. Who introduced her to these various activities?
Well, Mom, Beata, and Kyle, they did ice skating. At first, it was the two kids, and Mom was sitting on a cold bench in the ice rink. So she decided to start ice skating. Then that was up in Chicago area. And then she did the same thing here. Instead of sitting there, she then, while she was doing her treatments, different patients in different locations, if she went by Ellington, she would take her lunch and skate.
Well, from what you saw, did Maya have a difficult time doing activities that she used to share with her mom?
It brings back a lot of memories, yes.
And were you pleased he was at least trying to do these things?
Yes. Oh, yes.
But was it typical that when she tried an event, a sport, a hobby that had been introduced to her and supported by her mom, it didn't last very long?
Yeah, and I see that with the piano as well right now, too.
Is she playing piano much anymore?
Not much.
She play a lot before your wife died?
It was every day, and in fact, she did it in the hospital as well. She enjoyed it at that time.
So she doesn't do that anymore?
Not much.
She tried ice skating. Does she do that anymore?
No.
Of course, never got back into gymnastics.
No, and her workouts are very limited right now.
So many of the activities that she used to enjoy, can you tell the jury whether they're now no longer there or limited?
Objection to leading.
Overrule that objection.
A lot of them are gone.
Are you aware that she quit Cracker Barrel?
She did, yes.
Are you aware she quit Cracker Barrel after a matter of a couple weeks?
Yes, she had a dizzy spell, several dizzy spells there. And like I stated, she didn't carry the food there. She had one of the people that clean up or somebody from the kitchen carry the food.
All right. Now, let me ask you about a note that was put in front of you with Beata's handwriting that said, IV ketamine, desperate.
Yes.
Can you tell the jury how the IV ketamine was administered? Was it administered through the arm or was it mixed with something?
Yeah, this is a little confusing. Originally, after the treatments, she would get some take-home, I don't want to say take-home ketamine. She had pre-filled syringes without a needle, and it was given orally. And these were made up at King's Pharmacy in Palm Harbor, Florida. So after her treatments at Dr. Hannah's, we would have to go pick up that prescription. And these were for to give at home. It was difficult after a treatment to go to King's Pharmacy and pick it up because you have the child in the car and she just got out of the treatment, so she's tired in that. But we did that.
Well, how did you administer it? Did you mix it with something?
That one was mixed. I don't know if there was a flavoring in it at that time. But then she also had ketamine ointment for her lesions, to rub on the lesions. And then after time, the cost of those pre-filled ketamines for the oral, I believe they were pretty expensive. So at one point, they went from that to ketamine IV. It was a vial, and then you pulled the ketamine out of there, mixed it with Gatorade, and then gave it by mouth, oral. But it was confusing because now you got a IV prescription for ketamine. And that would last a while, I believe, because it was bigger or something like that.
Will you please tell the jury whether you ever saw, heard, smelled, tasted anything in any way, heard from Maya, anywhere else, that Beata was giving Maya IV ketamine as an IV at home?
No.
And when Maya came in that first day, do you dispute many of the things that they put in those records?
Objection, vague.
I'm about to.
Sustained.
Do you dispute the inference from what they're saying that Maya was thrashing around needlessly? Was there purpose behind that?
I justified that earlier. Yeah, I stated she was thrashing, but it most likely because of the blood pressure. And it's like putting gasoline on a person and lighting them on fire. I'm sure if you try to take their blood pressure, they're not going to cooperate with you at that time. I hate to use that analogy, but
You know, it's interesting. On the photographs we do have of Maya in the video, you know, she doesn't seem to be that bad. Did you make a habit of videoing her or photographing her when she was curled up in bed on a bad day?
personally, I hate it too. It tore me up. And just seeing some of the pictures today of her little legs and her trying to lift them up, I don't want to ever, I cannot wait till this is over with to get rid of all that.
One moment, Your Honor. On the amounts, finally, on the amounts involved in and the number of entries on those Aetna billing forms, are you worried so much about the fact that it's the percentage or amount, or the fact that Johns Hopkins was telling Aetna, and apparently privately, saying she had CRPS, while in public and in discharge notices saying that was Munchausen by proxy?
Objection, leading, and misstatement.
What, if anything, was your concern?
I sustain the objection.
What, if anything, was your concern about them putting CRPS in the bills, billing Aetna for CRPS, while things like that, discharge, were saying Munchausen by proxy?
Objection, leading, and argumentative.
I ask what?
Overruled on that one.
My concern was they're billing for it, but they didn't treat Maya for it, which she definitely needed treatment for CRPS.
Mr. Shapiro, any further questions?
Very briefly, maybe only one.
Checks in the mail.
And Mr. Kowalski, just to be clear, when you met with Detective Graham, everything you told her was true, correct?
Like I said, she led me to answer some questions, but I did not lie.
That's my question to you. When you met with law enforcement, were you truthful with them?
I was truthful with her,
Thank you.
but I was led to certain things.
Well, sir, whether you were led there or not, were your answers to the detective truthful or not?
Yes.
Okay, thank you.
Mr. Anderson, anything further?
Was the fact that somebody had called the sheriff's department to get her down there of concern to you?
Very concerning.
Did you believe at the time you were giving those answers you were under duress and being threatened?
Objection. It's beyond the scope. It's also argumentative.
Overruled.
I stated that earlier. Yes, I was.
No further questions.
Nothing further, Your Honor. Thank you.
Members of the jury, do any of you?
Alrighty, so that is going to conclude at least this day of the father's testimony. We're going to see a little bit more of the father in a bit, but until then, we're going to switch over to the social worker that dealt with Maya and her family. She's the one that we'll later hear on phone call recordings hanging out with Maya a lot. And allegedly, this social worker has had interactions with other families similar to Maya's family, unfortunately, in terms of
In the 13th. Yes.
in terms of claiming Munchausen by proxy. So she has had a rocky career and some questionable actions. So let's skip to that.
Okay. Please be seated, everybody. Anything we need to address before we bring the jury back in?
No, on behalf of the plaintiff. Don't believe so, Your Honor.
Okay, let's bring in the jury.
By the way, this is going to be a pre-recorded deposition from the past that they're going to play in court.
And that no one from the media or no one has approached you about this case since you went on break. And that you have not seen any media coverage since you went on break. Okay, Mr. Anderson, who are we calling next?
Yeah, that's right. I have a deposition of Catherine Beatty. Catherine Beatty by deposition.
Okay, Mr. Reyes, you may, whoops, I need to turn the system back on.
Would you please raise your right hand? Do you solemnly swear or affirm that the testimony you're about to give will be the truth, the whole truth, and nothing but the truth?
I do.
Please state your name for the record.
Catherine R. Beatty.
Good. And where do you work?
I work for Johns Hopkins All Children's Hospital.
And what is your position?
I'm a pediatric intensive care licensed clinical social worker.
Have you been disciplined in any of your jobs?
Yes.
Right. Have you been disciplined in any of your jobs?
Yes.
All right. Tell me where and why.
I was disciplined at Johns Hopkins for yelling at another coworker.
And what was the consequence? Were you
It was just a written.
a write-up, basically?
Yes.
What happened there?
It was. I'm not sure I understand your question.
You guys got into an argument?
Yes.
Okay. But whatever happened, Johns Hopkins felt it was necessary to write you up?
That's my understanding.
Okay, so in any event, after that discipline, were you subject to any retraining of any kind?
No.
And obviously you were not fired.
Correct.
What was the name of the person that made the complaint against you?
Her name is Pam. For the life of me, I don't remember her last name.
And what was her position?
She was a case manager in the cardiac care unit.
What's a case manager? Is that another social worker?
No, case managers.
The nurse?
No, well, she is a nurse, but they work to coordinate discharge for medical equipment, medications, home nursing. They work to help discharge patients to rehab centers.
And what was the essence of the dispute?
Yeah.
Here, let me show you. Maybe I can help you. I'm going to show you Exhibit 3 for the record.
Okay.
And what is that date?
11/18/2016.
2016. 11/18/16.
Yes.
So this was during Maya's stay?
Yes.
Okay. And what happened? Were you complaining at the time of covering more than one unit, if you will, or floor?
Yes.
At that time, were you covering more than one floor?
I was covering 2 units.
What units?
The pediatric intensive care unit and the cardiovascular intensive care unit.
All right. Where was Maya Kowalski? What unit was she in at this time, November?
She would have been on the 7th floor.
And what was that?
The 7th floor is a med surg floor along with,
Med surge?
yes,
What
so
does that
some of our
mean?
medical and surgical,
Okay.
yeah,
So for surgery.
yeah. And there's also EEG floor.
Why was she on that floor?
I don't know that.
Okay. But was that your assigned floor? In other words, were you part of med surgical or EEG?
No, I was not part of that.
But yeah, you stayed with Maya when she moved onto that floor, did you not?
I did.
And then in November, what's the date there?
November 18th.
You were complaining that you were essentially overworked by having both the pediatric intensive care and the cardio intensive care units to look after?
Mm-hmm.
So yes.
I'm sorry.
And you chose nonetheless to take on responsibility for trying to manage visitation and counseling needs for Maya Kowalski?
It was an assignment. It wasn't something that I chose to do.
Okay, for the record, Miss Beatty, it's from Nina Bagby Bishop. Who's she?
Yes. She was a social worker that was with the hospital.
All right. And it's to you, and it's dated October 19, 2016. Subject is 709 Maya Kowalski. Was 709 her room number or something? That designation there?
Yes.
Yeah, figured. Okay, and it says, Dear Kathy, Avon said you were wanting to continue to follow this child. Please let me know if you plan to do this now that she's on my floor. Thanks, Nina. All right, so I'm guessing Nina was the social worker on the 7th floor?
Correct.
And it says Avon. Who's Avon?
Yvonne was another social worker.
Avon said you wanted to continue to follow this child. Is that true?
No, it was assigned, and I said I would continue to follow.
Okay, so when Avon said you were wanting to follow this child, Avon was incorrect.
Correct.
You were assigned it, and you did not ask for this assignment in any way?
I don't know. I don't think so.
Did you receive any instructions, or including to just keep them up to speed from anybody from risk management?
Yes.
And who was that?
I talked with Patty Condon.
Okay. Patty, a doctor or nurse?
I don't know what Patty's profession is. She's
Okay.
in risk management.
Okay. Who else?
That would be who I talked to in risk management, mostly. I may have talked to Louise.
Was risk management fairly involved in this case? Maybe not initially in October, but after a few months?
Yes.
And so let me ask you something about how you got involved in this case. First, I want to know a little bit about your qualifications for a case that I think you would agree with me is this complex. Would you agree with me this is a complex case?
Yes, I would agree with you.
Tell me what, before being assigned to Maya, what specific training you had in CRPS?
I didn't have any in CRPS.
What is RSD?
It's regional pain disorder.
Okay,
I had to think about it.
all right. How about, do you have any specific training in RSD?
No.
How about Munchausen's by proxy?
Yes, in graduate school.
Okay, and what was that specific training that you had in graduate school?
Psychopathology.
And how long would you say they spent on Munchausen by proxy?
I can't tell you, that was a long time ago.
I mean, was this an entire course devoted to it, or is this one of several subjects of knowing about different abuse disorders? What was it?
It was a course designed for psychopathology that also there was highlights of child abuse, different forms of child abuse.
Okay. And prior to the allegations against Maya Kowalski, how many cases, if any, of Munchausen's by proxy, where it was confirmed it was Munchausen by proxy, had you handled?
3.
All right. 3 cases.
Mm-hmm.
Did anyone at Johns Hopkins, management or physician-wise, ever question leaving you on such a sensitive case as Maya Kowalski after the write-up with your conflict with a coworker?
Not that I'm aware of.
So they left you on despite this incident, right?
Yes.
Would you agree with me that 3 cases do not make you an expert in Munchausen by proxy?
Yes.
Would you agree with me that you have no background training and experience to provide any expertise in Munchausen by proxy?
To provide?
Any expertise in Munchausen by proxy?
I have a little bit of knowledge of it from the cases.
All right.
But I'm certainly have not researched, and I'm not a...
All right, so when you gained knowledge, though, it was from physicians, I would gather. Psychologists or doctors, people like that.
Sometimes, yes.
Well, did you read things about it or study anything
Yes.
about it? Okay, what did you read and study?
So through graduate school, I read many of articles that were written in the medical literature, along with the social work literature.
Specific to Munchausen by proxy?
Yes.
Okay. So then, are you telling us you had sufficient knowledge to determine whether a specific action, inaction, or behavior was consistent with Munchausen by proxy?
That's not my role at the hospital.
Okay. You alone would not know whether a particular activity, action, reaction, symptom was part of what, say, a DSM-4, DSM-5 diagnosis of Munchausen by proxy would be.
No, I would know.
You would know which was a symptom and which wasn't a symptom?
I would know some of them, yes.
Okay, name the top 5 symptoms of Munchausen by proxy.
The parent seeks multiple medical professionals in order to get diagnoses on very vague kinds of symptoms. The child may be admitted to ERs or multiple hospitals.
All right.
The parent is often unwilling to share information from other providers with current providers. The parents are demanding of certain medical treatments that seem out of place or out of line with the current medical diagnosis. The parents seem very attentive to their child.
Anything else?
You asked for the top 5, so.
Okay. I was thinking more in terms of physical symptoms of the child themselves.
Physical symptoms of the child is, again, very vague diagnoses. Symptoms could be just about anything, depending on what the parent was using.
Distinguish for me the telltale lesions from CRPS from, say, scratches.
I can't.
Okay. So these seem like more psychological evaluations about the parent's willingness to share information, right?
That's part of the DSM-5 diagnosis.
Okay. What is your role then?
So my role is to coordinate with the unit the needs for the patient that might be getting the medical team together in order to discuss the progress of a case, to discuss with the parents the medical condition of the child. I work with and making sure that all the multidisciplinary teams are working with the patient that need to work with the patient.
Aren't those medical decisions?
Well, if they are medical decisions, but if I have questions from PT, OT, or speech therapy, I may be working with them to make sure that parents and the providers understand what the needs are. I also work a lot with DCF on cases. So I'm making sure that the DCF orders are followed. I'm working with detectives and CPIs in coordinating their access to the patients, coordinating their access to records.
When you start caring for a patient, do you read the chart?
Yes.
Do you determine what the operating diagnosis is?
Yes.
Did this child's operating diagnosis include complex regional pain syndrome?
Her diagnosis included that, yes.
As soon as this child, the medical doctors, not you, hospital determined in the chart that she did have complex regional pain syndrome, that invalidated any allegation of Munchausen's by proxy, correct?
That was not a determination for me to make.
Well, you said that you'd read up on it, right?
On Munchausen, correct.
And you did recommend on multiple occasions that the child be kept in the hospital, did you not? I just read it to you.
Yes. Yes, I did.
And on multiple occasions, you made recommendations to keep the mother away from the child, did you not?
Yes.
And on multiple occasions, you made recommendations to limit the child's contact with certain family members, including the father, did you not?
Yes.
All of the things you were doing were based on a presumption that there was Munchausen's by proxy going on with this family, right?
Not my presumption. At that point, she had been sheltered, and I had to follow the shelter order along with the visitation orders that were given by the court. I made recommendations based on how Maya was participating in her therapies and with the staff.
Isn't it true you were the person in the hospital that had the primary control over who saw Maya, what Maya ate, what she did, who she could talk to?
No.
Okay, who else in the hospital, after reviewing all of these emails and memos we're about to go over, who else had day-to-day control over who Maya could see and not see, and who could come in at what time and not come in at what time? What other person?
That was up to the court order.
You read all these court orders before this deposition, did you not?
I did read the court orders.
And you're aware that when those limitations were put in, that the court then deferred to the hospital for the specifics of everything, right?
Correct.
The court made certain general findings for the benefit of the child, but then deferred to the hospital about how to implement those, right?
Correct.
Order behind you, but you were the person in terms of when we get to the hospital's discretion on to do things, you were the person that had most day-to-day control, if you will.
I was at that point consulting with Risk, and so that would have been up to Risk to interpret, and I asked many times to have Risk interpret them for me so that we knew what we were supposed to do and not do.
Right. But the day-to-day implementation of the orders left it up to the hospital, right? The hospital's discretion, correct? You can answer.
As much as we could.
Okay. That discretion then, is it your testimony here that your discretion, whatever actions you implemented regarding who got to see Maya, how much they got to see him, what she ate, all of these things that involved limitations on her life while she was in there, those actually came from the Risk Management Committee, right?
Yes.
If the father has visitation rights, who was making the decision of how, where, and when Jack Kowalski could see his daughter?
DCF.
So you were not involved in making that decision?
No.
Where are the orders from DCF?
This is it.
Okay. It says supervised. So in order to supervise, what did you understand needed to happen?
DCF had to give us somebody to supervise the visit. We don't do that.
Okay. And did they ever give you somebody to supervise the visit?
Mr. Kowalski had visits, so yes, I would assume they did.
Okay. Well, how did you know who was authorized to visit and who wasn't?
So CPI would call, or somebody from the Department of Children and Families would call us.
Who made the initial call to, or either call to the hotline?
The first one was made by Debbie Hansen, and the second one was made by Elaine Brown.
Debbie Hansen And who's Debbie Hansen?
She was a social worker at the hospital.
Did you ever speak with her?
Well, yeah, I mean, she worked on the
About
team
this?
with me.
Okay. And then who was the next one? Elaine Brown?
Elaine Brown.
And who is Elaine Brown?
She was their social worker on the weekend.
Did it strike you, or does it strike you at any time, how serious it is to take a 9-year-old girl away from her family?
Well, yes, definitely.
How harmful that is to a child?
It can be.
Okay. So what did you understand was the reason that a shelter order was entered?
My understanding from the shelter order is that they had information from Dr. Smith and our medical records.
Okay. Dr. Smith then and JHACH medical records, right?
Yes.
As one of the people who saw Maya the most in the hospital, tell this jury what you saw with your training in Munchausen by proxy that indicated that this family was abusing Maya.
So what I can say is that the medical team reported to me that the
No,
parent...
I'm not asking what people reported to you. I'm asking what you saw with your own 2 eyes, Mark 1 eyeballs. What did you see that would support that?
I heard and saw the mother on...
You heard what?
I heard and saw on numerous occasions the mother demanding from the doctors that the child be given amounts of ketamine. And I heard discussions from the doctors saying that that was too dangerous.
Did you know at any of those times that there were multiple expert doctors who had actually prescribed that amount of ketamine?
I didn't know that.
No one ever told you that Dr. Kirkpatrick she was under his care and he was prescribing that? Did you know that, or did you not know that?
Early on, probably not.
Did you know Dr. Hanna was prescribing that?
Early on, probably not.
Okay, well, if it wasn't JHACH doctors, how would you know what is an appropriate amount of ketamine for a complex regional pain syndrome 9-year-old during flare-up periods? How do you personally know that?
Well, personally, I don't know that.
Thank you. Attending reports Nemours told the mother the current care the patients receive from other providers is not the standard of care, and it could be harmful, if not deadly, to the daughter. Patient would So this is you repeating back what a doctor said that another doctor at Nemours, who was not treating the patient, said was the standard of care, right?
Say that again, please.
This note reflects, is that your note?
It's my note.
Okay. So this is your note stating that you heard from a doctor in the pediatric intensive care unit, right? That's where you got the information about Dr. Santana. You never spoke to Dr. Santana yourself?
She was actually on the phone with us.
All right. So you were on the phone when she was talking?
Yes.
Okay. So would it be safe to say then that your basis with your own eyes and ears, which was the question, for why Maya should be taken away from her family was this request for an amount of ketamine that was in excess of what you heard was appropriate. Is that right?
Correct.
And did you explain to her why the report was made?
I attempted to, but she shut me down and didn't want to talk to me about why the report was made. She wanted me to name the doctor that made the report, and she wanted me to call whoever that doctor was and have them rescind it. She also wanted me to speak to risk management immediately and get them to call her back.
What's wrong with that? That's an indication of child abuse.
No, let me rephrase that. in all of my dealings at the hospital, I usually don't have parents who ask for risk management and who don't demand that we call the hotline report and have it rescinded. Also, she was saying at that point she had no intentions of following the recommendations here. I watched her and observed her in rounds, demanding with the doctors of what to be done.
All right. But look, you're talking about taking a little girl away from her parents. Are you telling me that, to the best of your knowledge, Johns Hopkins All Children's Hospital took this little girl away for over 3 months because of a dispute over dosage?
First of all, Johns Hopkins didn't take this child away from her parents.
We'll get down with that later.
Okay. So that was a court decided that through DCF.
I understand that somebody called DCF and complained that this was child abuse and that this child should be taken away from her mother, and that the people that said that were all Children's Hospital doctors, social workers, and nurses. You understand that, right?
Under Florida statute, we have the responsibility to report all suspected child abuse.
And I'm going to direct you to the second page, which is 001142, plaintiffs 1142. Are you familiar with this? Exhibit 8?
Yes, sir.
Okay. And if you look at 1142, the next page there, it says at the top, under the family have the right, the middle column, it says to talk with another doctor or specialist at your own request and expense, or to ask for a transfer to another healthcare provider, providing it is medically acceptable and the other provider will accept your transfer. Is that right?
Yes.
Did they have the right under JHACH Bill of Rights for patients to get transferred out of there upon request?
Yes.
Did they have a right, that is, did Maya have a right to a timely response to her complaints of pain, according to that?
Yes.
Did they have a right to participate in decision-making and being informed of options in pain management?
Yes.
Well, if she's repeatedly stating that she's in pain, it's a pretty good indication she's in pain, isn't it?
When we look at pain and when I see kids in pain, Maya was never showed some of the symptoms that we see other kids in pain having.
Okay. Tell me what training you have in the identification of pediatric pain.
So on an ongoing basis in the unit, I work with kids that have chronic pain or that are having pain from certain procedures and or things that have happened to them. We work on coping skills, sometimes relaxation therapies, sometimes mindfulness. I see children in pain from surgeries, car accidents, traumas. We see kids in pain from cancer. We see kids in pain from just, again, a multitude of things that might be happening to them medically.
Okay. Well, are there any accepted medical symptomology, I guess it would be, about identifying pain in children? Any criteria, any objective standards, or is this all subjective?
I think, again, that what we look for at All Children's, that when I am actually in front of a child, what I'm looking for, and they're saying that they're in pain, we're looking to see how they're dealing with their daily functioning. We're looking to see again some of the things that they might be showing us, because not all children are going to be talking to you. So we might be looking for signs that they're uncomfortable in the bed, they're moving around a lot, they're pulling on an area that they might be in pain, they're avoiding touch. We would look to see if they were crying.
Okay, well, Maya cried, did she not?
Maya cried, but not while she was reporting pain.
Okay. Are you saying that Maya was not really in pain?
I'm not saying that at all. I'm not saying, what I'm saying is, again, that Maya did not show the same type of pain symptoms that other children showed.
She showed exactly the same pain symptoms that other children showed at certain times, and at certain times she did not, correct?
I would say that Maya's pain was different than all the time from other children's pain.
How many complex regional pain syndrome children have you treated on a regular basis?
I think we've seen 2 or 3 in the pediatric intensive care unit.
Okay, and so complex regional pain syndrome is a little different than having a broken leg, is it not?
Oh, yes.
Complex regional pain syndrome involves a burning sensation under the skin, right? It's quite painful, is it not?
I've never had it.
Well, have you read anything on it?
I have read something on it.
Okay, so Maya's symptoms of pain were consistent with children who have complex regional pain syndrome, were they not?
Again, I'm sorry, I'm shaking my head. Yes.
They were, right?
Yes.
Sorry. Okay. I mean, they weren't any different than the 2 or 3 you'd had before. Right.
Oh, they were different. Yes. No, they were different. The other kids that we had that had complex regional pain disorder were often bedridden for days at a time.
Well, so was Maya.
For the 95% of the time, Maya was up in her wheelchair, going to activities within the hospital.
Except on the days when she complained of extraordinary pain, right?
95% of the time that I saw Maya was up in her wheelchair, and the times that she would report extraordinary pain would be when she was prompted by her mother.
Prompted by her mother.
Excuse me.
Are you finished?
Are you finished with the answer?
Prompted by her mother, or if somebody asked her if she was having pain. And sometimes that was in the setting of being down in the child life department has a room, an activity center down on the 2nd floor. So I do know that there were a couple of, maybe it was the guardian ad litem or the CPIs that met her down there. And while they were watching her have these activities, she was reporting her pain as being a 10.
Okay. Is it true that Ms. Kowalski wanted to record the phone calls?
Yes.
With you?
Yes.
But that you objected?
I did.
Why would you object to that?
So I think that All Children's, we have a policy not to be recorded. And I was told by risk management that we weren't agreeing to be recorded in those phone calls.
There's a second volume, so they just need to queue it up.
Did you ever have any discussions with anyone from risk management to the effect that the Kowalski case, the Maya Kowalski case, was, and you can use whatever term you want, thorny or difficult or required a focus, was special in some way?
Yes.
And tell me about those conversations.
I can't tell you specifics. I can tell you that that there were definitely discussions that this was different than any other case because of the level of legal involvement.
Elaborate, please.
Usually in cases that I deal with on a day in and day out basis in the PICU, when you have child abuse cases, the patients themselves do not have like a private attorney. Typically, we don't have patients that stay for as long as Maya does and go through as many different legal proceedings as this case did. Typically, we don't look at 3 or 4 different discharge dates for a patient. That we have up in the PICU.
Explain about the discharge dates.
So initially, there was a discussion to try to get Maya to Nemours once she had been sheltered. And case management, and I worked on that discharge plan, working with Nemours to get them the recommendations they were going to need, or getting them the records, I'm sorry.
And what happened there?
When I called Mom said that there was going to be a discussion with her attorney later that day. I called her back and she said she couldn't consent or not consent to the discharge to Nemours.
And the reason that she gave was because the discharge to Nemours was with a psychiatric diagnosis, correct?
I don't know that she gave me that information. I think she said that she couldn't, I think all she said to me was she couldn't agree or disagree, or couldn't consent or not consent to the discharge.
Well, did you ever learn that the reason no hospital would accept Maya was because ACH decided to keep psychiatric diagnoses in her record, and no hospital would accept a child with these psychiatric issues, alleged psychiatric issues?
Actually, Nemours was willing to accept Maya.
On what basis?
We could have transferred Maya that day that I talked to Mom, and I don't remember the day, but Mom wouldn't consent or not consent. We also had discussions with, I think it was Kennedy Krieger, who suggested another program, and I can't remember the name of that program.
If the mom signed off, strike it. Did you ever see any of the papers involving the sign-off that the parents were required to make in order to transfer the child?
I don't know what you're asking me.
All right. There's a recording of a conversation between you and Beata about the potential transfer of Maya to Nemours. You didn't tell her or wouldn't tell her what program she would be transferring into. And Maya and Beata said they would only transfer if it was into a CRPS program. Do you remember that conversation?
I don't know what you mean by a recording.
A phone call that was recorded between you two.
I don't. So Give me your question again.
Did you have a conversation with Maya?
Yeah.
Excuse me.
Yeah, with Mom.
With Mom. Did you have a conversation with Beata on November 3rd, 2016, where there was a discussion about the potential transfer of Maya to Nemours?
Yes, I think I did.
And was the discussion centered on the type of program that Maya would be transferred into?
We were transferring, I think that in all actuality, she was going to an inpatient treatment program at Nemours that would focus on cognitive behavioral therapy, pain management therapy, and PT and OT therapy.
A psychiatric program, in other words. They weren't there to treat CRPS. They were there to convince her she didn't have CRPS, right?
Actually, no.
Okay.
It was supposed to be part of CPRS treatment, which would work on cognitive behavioral therapy along with pain management and then PT and OT therapy. And that was the program at Nemours.
It wasn't a complex regional pain syndrome program, was it?
I don't know. It was a Nemours patient or Nemours program, and we attempted, yeah.
Okay, but whatever was represented to Mrs. Kowalski, she refused to have her child committed to that program, right?
Yes. Well, she said she couldn't consent or not consent.
Okay. And then what happened after that?
Maya stayed at All Children's. We continued to look for, we were directed by DCF to continue to look for programs.
Well, so did you ever receive any notification or was there any discussion that included you that Maya was not getting better and that CRPS was present, thus the allegations against Beata, the child abuse allegations, needed to be dropped?
No one ever said that to me. And in fact, we noted on several occasions where Maya was moving her legs, moving her hands without any pain. Maya was engaging in activities such as foosball, cutting out and making crafts in the craft room. She was out playing the piano downstairs and often moved herself around the hospital. It was only after we gave that information to DCF that Maya then decided or quit moving herself around the hospital for a few days. It was noted in some of the music therapy and in PT therapy that she was able to move her feet and her hands and didn't complain of any pain while she was doing that. On occasion, when I would be in the room with Maya, Maya would be showing me her Shopkins, her prayer cards, and she was moving herself in the wheelchair, laughing, giggling, playing. She would be putting on her makeup, wanted to put makeup on me, wanted to put makeup on some of the nurses. And all during those times, there was no pain. And there were, Maya was very engaging, working really hard with the staff.
So you think, so we understand your testimony, that Maya was happy and thriving in the hospital?
There were many days that we saw Maya doing really well in the hospital and working with the therapists that were involved with her, yes.
And you say, I just left Maya's room. She told me she is furious, angry, and in pain. She told me she can't talk or trust anyone, and she knows there is court on Monday and it's all lies. Maya told me if I have a problem, I need to talk to her attorney.
Yes.
Right?
Yes.
So she's telling you there she's furious, angry, and in pain. Does that sound to you like she's thriving?
Actually, there were very few days that we saw her like this. And this was only after either a visit or a conversation with somebody on the phone.
Uh-huh. So you're blaming it on who this time?
I'm not blaming it on anybody.
Did you listen in to her conversations with her attorney?
No.
Did you listen in on conversations when she was trying to talk to the judge in court?
No, I don't think so. Mm-mm.
So if Maya testifies that the reason she was uncomfortable with testifying over the phone and wanted to come into court was that she was terrified of you sitting next to her and what you would do to her, she'd be wrong?
Yes.
Okay. She just made that up, that you were sitting next to her during her court appearances.
I don't know that I was sitting next to her. I think she was
room.
She was with her attorney at those times.
Were you in the room?
I don't know. I don't remember being in the rooms.
Did you require Attorney Kelly to leave the door cracked while he was meeting with her?
We may have.
Why did you want to leave the door cracked while Maya was trying to consult with her attorney?
We were not in the room with her, but there had been an episode where Maya said she fell out of her wheelchair and was on the floor for hours. So at that point, it was discussed with risk management, and risk management wanted the door left open so that we could make sure to monitor the patient.
Really? So you think the attorney was going to let his client lay all over the floor and not help her? So you guys had to be there right beside her or listen in. Strike that. So the purpose of cracking the door and being right there next to it, because you were standing right next to the cracked door.
No.
So you were going to be able to hear it by Maya shouting and screaming down the hall?
The door was left open so that the nurses could observe and make sure, because as they were walking by, it was not me observing. This was the nurses observing that were on the unit.
Okay, so, and the theory was that while Maya was in the room with her attorney, there was still a chance she would fall out of the bed and her attorney would not ask for help or otherwise assist his client lying there on the floor. So you guys had to be able to look in. Is that the theory? Was that the theory here?
So risk management, after that happened, wanted to make sure that the door was left open at all times so that there was site to site so we could make sure that Maya was safe, yes.
Why would it be a big deal that she fell on the floor?
I never said that Maya could move around freely. I said that we watched her move around with her legs. What Maya could and couldn't do was not my decision or making. I saw Maya move her legs. I saw Maya move her arms. I saw Maya move her feet.
All right, so the theory then was that because Maya said she fell out of a chair once, you guys had to leave the door open or cracked so that you could see her if she fell out of the chair, right?
That's the direction that we got from risk, yes.
Okay. And so is it explained to you that it was felt that the attorney would not be able or willing to help his own client if she did fall out of her chair with him there?
I can only speak to you what our direction was given, and that is that we had to leave the door open.
So it came down from risk management that Maya would not have, it was necessary to keep the door cracked, even when Maya was trying to consult with her own attorney.
Yes.
Did you ever confiscate a plastic bag filled with wafers and what? The host, holy water, prayer book. What else was in there? Did you ever confiscate that?
No.
You never took those away or prevented her from having those?
Never.
Okay. Was Maya allowed to see her priest?
That would have been up to the DCF order. We did have Father Tom that came and visited her when he was there on the weekends.
Okay, let me show you what we've marked as 13. Can you identify this?
It sounds like it's a telephone conversation.
Okay, had you ever seen this before?
No.
Okay. Who produced it, do you know?
No.
Were you aware that on this date that's being described here, January 6, 2017, that Maya was tired and spirits low, and that Dr. Hannah had told her that she was getting worse?
She did tell me that, yes.
Okay. Did you ever speak with Dr. Hannah?
No.
Why is it that JHACH chose not to discuss Maya Kowalski, or for that matter, Beata Kowalski, with any of the ongoing treating physicians?
That would be out of my scope of responsibility.
Were you involved in efforts to keep Dr. Hannah off the premises?
That would be out of my scope of responsibility.
Was DCF also monitoring the call?
Sometimes they were monitoring the calls.
Why, if DCF was already monitoring, did you keep being there as well?
In the beginning, DCF monitored those calls, and then those calls we were doing the monitoring. So because DCF and the guardian ad litem's office said they couldn't do those calls. So in order to facilitate the calls to make sure that Maya was getting them, we agreed to do that. I even came in on a couple of Saturdays to make sure that those calls happened.
Okay, but why did you have to be on calls when DCF was already on the calls?
There was a time that DCF wasn't going to be on those calls anymore, and we agreed so that Maya could get those calls with Mom.
And that's not really my question. My question is, during the period of time while DCF was still doing the calls, why was it necessary for you also to be on the calls? Because they were already being monitored by DCF.
The calls for the calls that DCF did, all I did, DCF would call my phone, and then I would take the phone in there and put it on speakerphone.
But why did you have to listen in too?
That's what DCF asked us to do.
Did you ever take Maya into the chapel?
No.
Did you ever sit Maya on your lap?
Whenever they had the last court hearing, or maybe it was right before Christmas, and Maya thought she was going home. I was called by Charlotte to tell, and Charlotte asked me to go in and tell Maya that Maya wasn't going to be able to be going home for Christmas. Maya became very upset, started crying.
I'm just asking you whether you put Maya on your lap.
She asked then to sit on my lap.
Oh, so Maya asked you for permission to sit on your lap? It wasn't my idea? Strike it. So you're contending that this wasn't your idea, that it was Maya's idea that she sit on your lap. Is that your testimony?
Yes.
All right. And did you kiss Maya?
I don't think so.
Were you hugging Maya?
I think that we provide comfort to a lot of kids. So probably why she was sitting on my lap, I'm sure I did hug her.
Who gave you permission to touch the child in this manner?
We provide a lot of comfort to kids.
Not my question. Who gave you permission to be this intimate with that child?
So Maya asked.
She's 11. What adult, either Maya's mother or Maya's father, the only two people, not the state and not the hospital, who gave you permission to be intimate with that child?
So currently at that time, DCF had custody of the child, and the case manager on several occasions asked that we provide comfort to Maya.
And in your view, comfort included what?
I talked with Maya. She held my hand. I would hold her hand. She asked me to come in and pray with her.
I guess your answer is no one with any authority to permit you to be that intimate with their child gave you permission to do so.
So I do think a couple of times that Mr. Kowalski and I discussed the fact that I provided comfort to Maya.
Well, was Mr. Kowalski complimenting you about it, or were you telling him that you were providing comfort?
I can't tell you how the conversation happened, but I can tell you that Mr. Kowalski thanked me.
So he's being polite. So by thanking you for comforting his child, is it your interpretation that that meant he believed it was okay for you to have the child on your lap and be able to hug her and kiss her?
Again, I don't think that I kissed her.
Are you sure you didn't kiss her?
Pretty sure.
So if Maya specifically remembers you kissing her and telling her it was going to be okay, that's just another thing that she made up.
Typically, I don't think I would tell any of the kids that were in this situation that they're in that everything's going to be okay. I think that we would talk about things look really bad right now, and I'm working more to help Maya with what her thoughts are, not with that's not usually in the repertoire of words that we would have used with her.
Are you a member of the National Association of Social Workers?
Yes.
Are you familiar with their code of ethics?
Yes.
Let me show you what we'll mark, and unfortunately it's highlighted, but I'm going to mark it as 14, and we'll swap out I need a stapler too, or pen. Let me ask you about section 1.10. Is that, does it appear to you to be the code of ethics for, what's your organization called?
National Association of Social Workers.
Does it appear to be your code of ethics?
Could be, yes.
And is there a specific section there about social worker responsibilities regarding physical touching of the patient?
Yes, there is.
And is that section 1.10?
Yes, it is.
Could you read it to the jury, please?
Social workers should not engage in physical contact with clients when there is a possibility of psychological harm to the client as a result of the contact, such as cradling or caressing. Social workers who engage in appropriate physical contact with clients are responsible for setting clear, appropriate, and culturally sensitive boundaries that govern such physical contact.
You had no specific authority to touch that child in that manner, did you?
I was asked by the case manager to provide comfort to her, and Maya asked if she could sit in my lap.
Well, a child can't give consent to be abused or touched, can they?
It's certainly at no point did I touch Maya in any way that was sexually related.
Okay. Would you agree with me that a child cannot give consent?
Children ask for comfort in the kind of medical setting that we work in at all times. We often sit with kids and hold their hands or hold them. I mean, especially when it comes to kids under the age of 10 to 12.
There's a big difference between a kid on your lap with your arms around them and holding a child's hand when they're scared, isn't there?
Maya was sobbing that night because she couldn't go home.
Let me show you Exhibit 15. For the record, it's an email from Kathy Beatty dated Monday, November 7th, 2016 regarding MK. It's to Audrey Peterson. You recognize this?
I don't recognize. I recognize the people on it. Yes.
All right. So who's Audrey Peterson?
She was the case manager for the 7th floor.
Okay. Okay, and it says, I'll call you later with massive update. Describe for me what the massive update was.
I have no idea without going back and taking a look at my notes from that day. So I guess I didn't have a chance to talk to Audrey that day, so I emailed her the next day. Said there was no update available as the parents will not consent or decline the placement at Nemours. There is a hearing today and Thursday that will clear up the matter.
That's a massive update?
Yes, because we were looking at discharge, and we were looking to get Maya on to some kind of physical therapy. So for us, yes, that whenever there's not going to be a discharge, that's a big update for us.
That's massive. That it's not going to be a discharge, huh? That's the only thing you guys discussed about Maya Kowalski or her situation.
Yeah, because I didn't talk to her on the 7th. That's per her email. But yes, anytime there is a delay in discharge, it's massive for us.
You've got an affidavit on November 2nd, 2016, and then Exhibit Beatty 16, and then we've got this November 7th email regarding massive update, which is 15. And then we have what I'm going to mark as 17, which is what? Tell me what that is. For the record, it's an email from Kathy Beatty to Megan Leaf at My Florida Families, dated November 9th, 2016, so 2 days later than the massive update email. Late in the day. What is exhibit?
This is Dr. Diana Young on the 9th day, indicating she did another affidavit for transfer.
All right, this is the second affidavit for transfer?
Yes.
All right. So let me get this straight. Am I correct that you helped on the first affidavit that said nothing about factitious disorder or conversion or anything like that, right?
Yes.
And then you do an email, I'm just talking about the timeline here, you do an email to Audrey Peterson, the case manager, where you say, I'll call you with massive update 5 days later, right? I'm sorry, it'd be 3 days later. No, it'd be 5 days later.
Yes.
Okay. And then 2 days after that, there's an email from you to Megan Leaf forwarding this affidavit of Diane Young, right?
This was on the 9th, yes.
All right. And you sent this to Diane Young. Why?
I didn't send this to Diane Young. I sent this to Megan Leaf.
Sorry, you did send it to Megan Leaf. You sent it to Megan Leaf. Why?
Because Diana Young wanted it sent to the state for, I guess they were having a court hearing.
Okay. Then.
Or they were going to get a judge so that we could go ahead and discharge.
All right. So, is Diana Young a pediatrician?
Yes.
Is Dr. D's a pediatrician?
Yes.
Were they both seeing Maya approximately the same time?
They could have been, one of them could have been working for part of the week and then the other one for the other part of the week.
Okay, but they were both seeing Maya, obviously.
Yes.
Both being attending physicians?
Yes.
And then Dr. Young here says the problems are bilateral lower extremity atrophy with conversion and factitious disorder. You see that there?
I do see that.
Why the difference between the two pediatricians seeing the same child?
I can't answer that for you. I wasn't involved.
You weren't involved in the second affidavit?
Nope.
Did your massive update have anything to do with the creation of the second affidavit from Diane Young?
No, it would have been about discharge because at that point we were looking to discharge.
Let me show you what we'll mark as 18 and ask you to identify it. And for the record, the first email is from Kathy Beatty, January 5th, 2017, dated, it's JHACH 10160 through 163. Ask you to identify that, see if you know this exchange.
Yes.
And what is this about?
So I think I'm pretty sure this is the day that Maya was going to the courthouse and then going to see Dr. Hannah. And we were asked to take pictures.
Risk management asked you to take pictures?
So I have to go all the way back to the beginning. So
it was 18?
Yes.
It's close.
So Dr. Danielson notes in her email about pictures. I was contacted. Patty wanted to know, is CVI able to help out? They can't. They're doing their own pictures in Sarasota. And then I indicate that I think that we should do them here at the hospital. Patty agrees. She suggests that 2 people are in the room, and she has a camera.
So who's Patty?
Patty Condon is risk management.
So risk management made the decision to have these pictures taken of Maya?
Yep.
And tell me what happened. What did you do with Maya?
The bedside nurse and I went in and took pictures of her arms, her legs, her face, and her stomach.
Was she in her bra and panties?
She was in her sports bra and a pair of shorts. I think we took pictures of her back too.
Bra, and she wasn't in panties, she was in what?
Her shorts.
Who gave you guys permission? I say you guys. Who gave risk management permission to take photographs of this little girl's entire body?
So that would be, again, I was directed by risk management to do that.
Did you object in any way to this?
No, I did not.
Had you ever taken pictures of a child without any clothes but bra and shorts before? Not your own, but I mean in your professional context.
In professional context, in the foster care program, if they were going to visit a situation, or when they came back, if there were injuries, yes, we did.
But she didn't have any injuries. She'd been with you for 3 months at that point, right?
Correct.
So did anybody give you any reason why they took pictures?
I was just directed by risk management to do that.
Was there any discussion at all of why it was necessary to take pictures of this little girl in her sports bra and shorts?
Like I said, this started with Dr. Danielson and came down to me.
Who's Dr. Danielson?
Her name, Dr. Danielson was probably the attending that day.
Okay, so this wasn't coming from the government. It wasn't coming from DCF, right?
This was coming from our institution, Dr. Danielson.
Right, not from DCF. This was an internal decision to ACH.
Yes.
What steps were taken to call the parents and ask whether you could take pictures of their child like this?
We didn't call we didn't call the parents.
Why not?
Because at the time the child was in the custody of DCF and they gave their permission.
How did DCF give permission for you to take pictures of this little girl in her sports bra and shorts?
So they were getting ready to do their own pictures.
Who was?
DCF. They did their own pictures in Sarasota.
So why was it necessary for you to do pictures?
I can only speak to you to what I was asked to do.
They didn't tell you why. They just said do it?
Yep, pretty much.
Well, pretty much.
Yes, the direction was to do the pictures.
Was Maya upset?
Yes.
She did not want you to take pictures of her like that, did she?
She did not.
But you went ahead and took pictures of her anyway.
Unfortunately, we did.
Was there an issue over scratches that Maya had on her?
Yes. So, according to my email, there was a concern that Maya was self-mutilating. And my note indicates on Thursday there had been inappropriate conversations with the mother that had been witnessed by staff. Or that was due to Charlotte's.
Okay. One last email here, and it's 19 because we're taking it out of order, and it's JHACH 9829 through 9831. Show you that. You recognize that?
Yes.
Okay, and what is this?
So this was a letter that Maya wrote on or around November 10th and wanted the judge to see. So I scanned this in, or faxed it to, I'm not sure which, to Safe Children's Coalition.
Who are they?
The community-based care organization that was case managing this.
All right. Did anybody give it to her lawyer or some way to get this to the judge?
That's why we sent it to Tanya Hutchins, who we were asked to send it to so it would get to the judge.
She says, I am not doing well at all. I'm hurting worse than I was at home. Is she telling the truth there to the judge, in your view?
I can only report what Maya's telling you.
And they are not doing a good job with therapy or managing my pain. Is she telling the judge that?
Yes, she is telling.
Any of the pain meds they give me don't work at all. Had she told you that?
No, she didn't really talk about her pain medications too much with me.
Okay. And they talked to the doctors about it, right?
Probably.
Someone dropped me the other day. Did that happen?
I don't know.
My parents did nothing wrong. They just listened to the right doctors for my meds, and guess what? It worked. Okay. And then ever since I got here, I got worse. It's causing me more pain, and I really don't want to go to Orlando for my rehab either. All I want is to go home, be with my family, friends, and never have this problem ever again. Please help me. Love, Maya. And then she puts a P.S. I had better therapy at home. Now, based on, you read this, right?
I did.
Okay. Did you ever have any interaction with any of the attorneys advising ACH?
Yes.
Who'd you have interaction with?
Mr. Hunter, but I also had interactions with another man. I don't remember his name.
Shapiro. Were you party to any conversations? You don't tell me the contents. Party to any conversations where any of the attorneys were involved?
Yes.
And was risk management involved in those?
I think so, yes.
Let me show you 21 and ask you if you can identify that.
Yeah. Yes.
All right. So you drafted this letter that's of November 29th, 2016?
I typed this letter up from Dr. Amin.
Okay. Did you participate with Dr. Amin in putting together these recommendations?
Actually, this would have come from the medical team.
And who was this sent to?
I think that we sent this to the case manager.
Case manager for whom?
For Maya, for the Department of Children and Family Services. It could have gone to Charlotte Laporte.
Okay. So this is the letter to the state.
Yes.
Okay. And in this, there's recommendations including visits with fathers suspended at this time unless supervised by DCF. That was the hospital's recommendations, right?
Yes.
Phone contact with mother limited to one time weekly supervised, and mother instructed she can't record phone calls, and mother is given same instructions as father. Do not discuss court case. Do not talk with Maya about her pain and what pain medication she is or isn't getting. Do not talk with Maya about food here at the hospital. Do not discuss the supervised visits when they are or aren't taking place. That's in there, right?
Yes.
Okay. Aren't those exactly the things that DCF turned around and instructed the parents about?
I think that prior to this, there had already been an email. I think that came on around the 17th of November. Charlotte Laporte had already given that information.
Then why write this? Why include these? If it had already been ordered, why would you do all these recommendations?
You have to, Dr. Amin. You would have to talk with Dr. Amin about that.
And you didn't discuss this with Dr. Amin while you were doing it?
Dr. Amin gave me this document to type up.
What input did you have in this?
I don't think I have a lot of input in this at all. Dr. Amin gave me a letter that she wanted sent to the court or to the case manager. And again, this is trying to position pieces of this to help Maya get to Nemours.
You also recommend Maya's phone be removed.
Mm-hmm.
Is that right?
Yes.
Members of the jury, that concludes the playing of the deposition. Are there any issues we need to address before the jury is excused?
All right, so now we're going to listen again to the father and questions about the social worker.
I'm more confident now, just kind of thinking about it a little bit more, that there can be some sort of journal entry that would qualify as a child victim hearsay, so long as you can show the other components of the statute. So, do you want to go ahead and have your witnesses? Is Jack Kowalski here?
I'm deciding him.
You were blocking him. So let's go ahead and have the child victim hearsay hearing and call whatever witnesses you want or need.
You solemnly swear or affirm the testimony you're about to give will be the truth, the whole truth, and nothing but the truth.
I do.
Your Honor, just to save time on the journal, so long as the whole thing goes in, to save time, we'll just agree to let the whole thing. We don't want segments.
Well, I think that's what Mr. Whitney said is they were fine putting the whole thing in. So at this point, are we, Mr. Whitney, I think this is what Mr. Altenburn, I think, is saying is they're okay with the entirety of 2364 coming in, which is number 1 on your list.
Great.
Okay, so the court will receive 2364. That's a completed issue, and now we don't need to worry about that.
Station name for the record.
Jack Kowalski.
May I approach with 2365-001, Your Honor?
Sure. Can we publish it?
Just put it out on the screen. Oh,
Want me to turn it?
yes, and actually put it back down on the ground.
Sure.
But let's not make it on the cord.
Okay. Does it go on?
Well,
Oh,
yeah,
right there.
there you go.
Awesome.
Well, you still have another cord under it.
Okay.
Thank you.
I believe it's that the feed, the video TV feed is going to be able to pick up the exact.
I just switched it, so you tell me if it's fixed.
I will let you know. Look at that.
I'm breaking technology left and right, aren't
It's
I?
fine. You're doing great. You can put it back later.
I told you I'm not a TV director. Mr. Anderson, you may proceed, and Mr. Whitney wanted the Exhibit 2365. What page, number 1 was it, Mr. Whitney, that you wanted up?
1, Your Honor.
2365-1.
May I please clear?
Yes.
Please state your name for the record.
Jack Kowalski.
Where do you live?
I live in Venice, Florida.
Are you the father of Maya Kowalski?
Yes, I am.
During the time of her stay at Johns Hopkins All Children's Hospital between October 7th, 2016 and January, I think, 13th or 14th of 2017, did you visit your daughter frequently?
Yes, I did.
And during those discussions, did your daughter relate to you certain unsettling or troublesome issues regarding the way she was being taken care of?
Yes, she did.
And did you then, at or near the time, record these in a note for future reference and memory and to point out the different abuse and threatened abuse against your daughter?
Yes, I did. I documented every time I went for a visit.
And is this trial exhibit 2365-001, was this completed at or near the time of a visit?
Yes.
Do you recall approximately when?
I usually jotted it down on a piece of paper and then I would type it when I got home.
So this is the typed referral of it.
That's correct.
And in this, did your daughter state, among other things, that she was scared to talk to the judge in court because she was worried about...
Mr. Anderson,
Yeah.
I'm going to want him to testify as to what she said. I don't want leading as to what she said. I think
Right.
I cannot have leading on this one.
I understand. What did she tell you at the time that you recorded this?
Well, anytime she felt there was a problem, she would tell me or write it down on a piece of paper.
And was she coerced in any way, or was this voluntary?
No, that was all voluntary.
And this is offered? Was this offered? What was the word I was looking for? Sorry. Was this volunteered?
She initiated it and gave it to me. She wanted me to know.
And can you relate what she related to you as best you recorded it using this to tell us?
Yes.
In terms of, and I know there's a lot there, but in terms of abuse, neglect.
How she would tell me, or I'm
Just
sorry,
what she would tell you.
she would tell me, if there was a problem, how she's being treated, things like that, and then also she would write it down on a piece of paper and give it to me. Also,
what were the types of abuse that she told you about on the visit that resulted in this recording?
Okay, I could read a couple here just to give you an idea.
Sure.
Well, I need you to tell me what she told you.
Tell us verbally what she told you that prompted you to go home.
She was stating that she was having issues within the hospital that she didn't agree with, that she felt that they're not doing appropriate things.
And can you describe more the inappropriate things that she was doing that caused you concern that your daughter was being abused or neglected?
Yes, there was incidents where the social worker was hugging her, kissing her, making faces while mom was on the phone with Maya, the supervised phone calls. She would make expressions, things like that. The social worker, she told Maya that mom's in the hospital getting mental treatment. There was a doctor, I believe it was Elliot, stated that mom was put Maya in comas every week at home. And it was just on and on. I mean,
what, if anything, did Maya tell you about her need for medication and what doctors informed her concerning that need for medication?
I can't have leading at this point.
What, if anything, did Maya relate about her need for medication?
Well, there was an incident that I could remember. The doctor said it was all in Maya's head, that she didn't need medication. It's hard to remember all these.
And what, if anything, did Maya tell you about her need?
She was in pain.
About her need for medication.
She was in pain. She needed medication.
Move to admit.
Brief cross-examination.
Yes, and then I'll probably have questions, so go ahead.
Well, if Your Honor has questions first, you're welcome to. I didn't mean to cut Your Honor off.
No, I'll wait till after you're done, because if you cover what I'm going to ask, then better for you to do it.
Good afternoon, Mr. Kowalski.
Good afternoon.
That you had testified a moment ago about having a visit. What date was that visit, sir?
I would have to look at the document. I don't know the exact date now.
Okay. The description you had of Maya telling you that someone was hugging or kissing her, do you remember what date that was?
You know, I have a journal that I wrote in, and that was all my notes were turned in to my attorney, and I believe you have a copy as well. And that does have the dates of all those incidents.
The discussion of people making faces at Maya, do you know at what point in the hospitalization that was?
It's within my notes. I do not know the date top of my head.
The discussion of the doctor disputing whether Maya has pain, do you know what doctor that was?
No, I do not on that.
And what's marked here for the court as PLT 034197, would it be true that you do not have an approximation as to when you generated those notes?
Not at this time, I do not, no. But like I said, you could find all the dates within that journal that I made up. You will find all the dates.
I appreciate your time, sir. Thank you.
Did you bring that journal with you by any chance?
I do have mine, yes.
May we approach?
It's in my bag.
Refresh his recollection.
If it refreshes his recollection, that's fine. Now, before you show it to him, you gotta show the defense.
This has been previously produced on numerous occasions and used, I
Let's
believe,
just show it to the
deposition.
Well, which, no, these are not his.
Some are his, some are not his. I'm going to have him turn to those that are either typed or in his handwriting.
Respectfully, I still haven't seen a note that you claim. There's a book of several hundred pages. Most of those are not his writing.
He has testified previously that he took handwritten notes.
Ketamine coma, being put under general anesthesia for 5.
All right, my apologies on that. Okay, give me 1 second and we'll try to get back to see if they're going to continue with any further testimony from the father. If not, we'll go into Maya's testimony.
And the 13th, yes.
Thank you. Anything further?
No, Your Honor, thank you.
Okay, Mr.
All right, that is pretty much where that's going to end. So let's go into we'll get through a little bit of Maya's testimony now. We probably won't end up finishing it all today. There's quite a bit.
All rise, Drew is entering.
Okay, please be seated. Happy Monday. Did y'all have a good weekend? Yes. Glad to hear that. I want to confirm that since you were last with us, that you did not discuss this case amongst yourselves, you did no investigation, and you received no information. Is that all correct? Correct. And has anyone approached you since the last time you were with us about this case? No. Okay. And have you seen any media coverage since the last time you were with us about this case? No. Okay. Mr. Anderson, your next witness, please.
My name is Jack Kowalski.
Do you solemnly swear or affirm the testimony you're about to give will be the truth, the whole truth, and nothing but the truth?
I do.
State your name for the.
Mr. Anderson, your next witness, sir.
My name is Maya Kowalski.
You stay here, face the court, and rejoin.
Do you solemnly swear or affirm the testimony you're about to give will be the truth, the whole truth, and nothing but the truth?
I do.
Please state your name for the record.
Maya Kowalski.
Maya, you have a very soft voice, so you'll need to get that microphone up there close so everybody can hear you. And where do you live?
I live in Venice, Florida, in a subdivision called Stonewalk.
And how old are you?
I am 17 years old.
Where were you born?
I was born in Elmhurst, Illinois.
Outside of Chicago?
Yes.
What kind of neighborhood?
It's a really small neighborhood. There was barely any houses. There was houses on both sides of the street, but only a single street.
And how were things growing up in your family? And we'll publish 2528-45 for this. And you can continue. I mean, we'll just...
Okay. So here I'm pictured with my dad's deputy chief fire helmet. You could tell I'm feeling pretty cool there. Growing up, Elmhurst was amazing. I loved it there, and it was like a quiet little place.
And did you get to spend some time with your dad and mom?
Both of them, yes.
They both worked?
Yes, they did, but they always made time for their children.
Did your dad ever take you to any fires?
He actually did take me to a few, but eventually he started dropping me off at my neighbor's house. The grandma was Polish, so Kyle and I could communicate with her pretty well.
Okay. And so during your time there in Elmhurst, did your mother or your dad introduce you to different hobbies and sports?
Yes, I was a ballerina at one point. I was a gymnast and then a figure skater. And then Kyle, he played soccer, he did piano. I also did piano. And then Kyle tried out gymnastics for a little bit.
Okay, let's show 2528-102. This is your mom and you ice skating. Was
Yes.
she your instructor at first?
At this point, no. My mom didn't teach me figure skating. She actually started after me. Here, we're in the Wizard of Oz production. I was a munchkin, and then my mom was a cowgirl.
Okay. And did you, let's go to 2528-115. How old were you when you were introduced to gymnastics?
I started gymnastics in Illinois. There was actually an incident on the playground. I approached a few girls and they were practicing their floor routine, and I asked if I could try, and they told me, no, you're too small, you'll never make it. So I went home, I told my mom, sign me up. She did, and I was actually really good at the sport from the beginning.
And you continued that through when you moved to Florida eventually?
Yes.
All right. And so were you able to spend some leisure time with just your mom? And we'll look at 2528-124. And by the way, so your mom didn't introduce you to gymnastics, you had the idea?
Yes, I did. Same with piano, and then ballet, all of them. They were all my ideas.
And your mom supported you in those?
Always.
And that story you told, has that been indicative of your life when people tell you you can't do something?
Oh yeah, I'm going to prove you wrong.
All right. So this is you and your mom now. Where is this? Is this once you reached Florida?
Yes, so this is actually Casperson Beach. It's the shark tooth capital of the world. There's a cute little restaurant there called Sharky's, and near it is this little pier, and after dinner we would walk on the pier and watch the sunset.
Mm-hmm. Was that something you and your mom did regularly, or tried to do?
Yeah, we did it quite often, actually, all of us as a family.
How was the transition from the suburbs of Chicago down here to the Venice area for you?
For me, it wasn't too bad. I did have my mom's family there and friends, but I was hopeful that I'd make new friends in Florida, and the idea of having a pool was really cool, so, I mean, that helped.
Mm-hmm. That was the inviting thing, the bait?
Yeah.
All right. When you moved to Florida, and really during this period of time before the CRPS, can you tell the jury about your health generally?
Generally, it was really good. I mean, I did have asthma. I was diagnosed in Illinois, but it didn't bother me so much.
And just childhood illnesses for the most part?
Yeah, I did break my arm at one point.
So tell us about that.
Yeah, so in our subdivision, the road, it went up on a hill. So I rode up the hill, and then I did like a little U-turn, and I was going down, but there was a car behind me. I saw it, I freaked out, and I crashed into this curb, and then I fell into a ditch directly onto my arm, and I broke it. After that happened, I didn't cry. I stood up, picked up my bike, dragged it out of the ditch, hopped right back on it, drove home, and I told my dad that my arm hurt, and he didn't think anything was wrong because I wasn't crying or acting, all dramatic. He told me to go lay down. I did. We didn't think much of it. A few days went by, and I was holding it in a weird position, and my dad's like, "You should probably go get that checked out." So we went to the doctors. They ordered an x-ray. We went home. We got the call from the doctor that it was fractured, and only then did I cry because I realized I wasn't going to be able to do any of the activities that I enjoyed.
So how many days did you have a broken arm without complaining to your mom or dad?
3.
How was your pain tolerance generally?
I've always had a really high pain tolerance.
So how old were you when you moved to Florida?
I was in 3rd grade, the beginning of 3rd grade, so I would say 8.
And how was that? How was the transition?
It was good. Yeah, I liked all the new animals. The lizards were really cool. I actually used to catch them and pinch them on my ears so they looked like earrings. And then Kyle and I, we loved going outside. We had like a little alligator in the back, and we named him Dzień dobry, which means hello. We did that for my mom.
And so I want to talk for a second now. Your mom, first generation Polish.
Yes.
Right? And how early did she start you learning Polish?
Well, we grew up learning the language. We heard it from our family and whatnot. But she enrolled us in Polish school in Illinois. In Florida, we didn't continue with that. We just did Rosetta Stone because there was no Polish schools in Florida. But Kyle and I hated Polish school in Illinois, but we did it for her.
And pardon me for asking, but what does one do in Polish school?
So the teacher exclusively speaks in Polish, which is kind of hard because then you don't really know what English words match up with the Polish words. We learned the alphabet, the numbers, and then different materials relating to reading and whatnot.
Would your mom speak Polish to you at home?
Yes.
How often?
I would say every day. I mean, I heard Polish from her, and I actually asked her to speak to me in Polish so I could get a good understanding of the language.
And you had relatives that spoke just about only Polish?
Yes, most of my mom's family only speaks Polish because they grew up in Chicago, which is one of the biggest ethnic areas for Polish people, so there's not really a big need to learn English.
Did you actually go to Poland at some point?
I did, yes. I went there for a month.
When? About? How old? Let me put it this way. Was this before or after you moved to Florida?
It was before I moved to Florida.
Tell us what you did there.
We visited about every city you could think of, all the cool cities. We saw like street artists doing cool things. We went to different shops. I actually bought a Polish doll there, which I was really proud of. We visited family, my mom's old house, and then my great-grandma, actually, I visited her.
Well, was your mom proud of her, of being Polish ancestry?
I would say so, yeah. She was very proud to be Polish.
Did you know about her story? Did she ever tell you how she ended up over in the United States?
I know that she moved over when she was a teenager, and she had to learn the English language. It was difficult at first, and a lot of people told her she's not going to make it into the profession that she wanted to be, but she proved them wrong.
Now, was this during, when, best of your knowledge, when she moved, strike that, did she grow up under communist Poland or free Poland?
I believe it was communist.
she tell you stories about that?
Not too many. Kyle and I were really young, so.
And is that still important to you, your Polish heritage?
Yes.
All right. And so I want to ask you about the neighborhood itself. Did you have friends there? Friends on or near your age?
Yes.
Several of them?
Yes.
And did you get along with them? I mean,
Yeah, we got along, all of us did.
where'd you go to school?
Well, for elementary school, I went to Taylor Ranch Elementary School.
Mm-hmm. And how was that?
I really liked it. The teachers were amazing, and it was very different than Illinois.
What was the difference?
Well, something cool about the schools, which is kind of normal for Florida, but very foreign to people who live in Illinois, is that the hallways are actually outdoors. So you walk outside to get to your classes, so it's nice just to see some daylight.
You can't really do that in Illinois.
No.
Not if you want to keep your toes. All right. So, did you generally do well in strike? How did you do in school over this period of time, having moved to Florida?
I was a straight A student.
And you liked your teachers?
Yes, I loved them.
All right. So let's jump ahead then. What grade did you start at once you moved to Florida?
It was third grade.
Third grade. So you completed second grade?
In Illinois.
In Illinois, so it was third.
Mm-hmm. And I actually did a week of third grade in Illinois as well, but I did the remainder in Florida.
I was going to ask you. So
yeah.
They come down and visit you every once in a while?
Some of my friends, yes.
Now, by this point, was your dad still in the fire department, or had he retired after all those years?
When we moved to Florida, my dad had retired.
And what did he want to do with his career, if you know?
Once he retired?
Yes.
I think he just wanted to take care of us, spend more time.
Did he have any dreams or aspirations, to the best of your knowledge, about working for FEMA or something else similar to what he had done in the fire department?
I've heard of that, but again, I was really young, so I didn't really know his career plans.
Well, let's jump then to July 3rd and July 4th of 2015. Now, how old would you have been then? This would be...
2015?
All right, yeah. So this will be, you've been in Florida, I think, yeah, you moved in 2014, so this would be 1 year after you moved.
I was 9 then.
All right. And then we can show 2528129. Now, what's happening here, although the jury, I think, has seen this?
Yeah, so my subdivision, we're really close, and the adults of the neighborhood, they organize special things for the holidays, and one of the biggest ones is the 4th of July parade. Everyone is welcome to hop on their bikes and ride around our circle. We just celebrate, and then afterwards we usually eat food.
Were you able to ride that bike well, or do you have any physical injuries at this point?
I know I had an injury to my ankle, but again, I was always pushing through, so here I don't really look like anything's wrong, but I hurt my ankle.
How soon before this was it that you hurt? Was this like a month before, a week before, a day before?
I'm going to be honest, I'm not sure, but I know that it was pretty close. I just don't know for sure if it was like weeks.
Well, how bad was it? Was it a sprain, a break?
I believe it was just a sprain.
Did you get any medical care for it at that time? Do you know?
I don't think so, no.
Did you even tell your folks? Is a question.
Yes, I did. My mom had wrapped it and everything.
Oh. But by the time of this photo, 2528129, it looks like you can pedal the bike.
Yes.
Pretty well. All right, and that's your brother next to you?
Yes.
Mm-hmm. And he got rid of that beard eventually? Just didn't work
yeah.
All right, so what happened? Tell the jury what happened over that 4th of July weekend that changed your life.
I had a severe asthma attack, and it was one of the worst asthma attacks I've ever had. I was taken to Johns Hopkins All Children's Hospital, and I think I stayed there for a couple of days, if I'm not mistaken.
Well, on the day that it happened, did they take you to the ER someplace else? Doctor's
Oh,
hospital?
doctor, yes, my bad.
All right. So if it happened on the 4th, then was a matter of a couple, 3 days before you went to Johns Hopkins?
Can you repeat that? Sorry.
Sure. About how many days after you were treated at doctors, and after you had this asthma attack, did you go to Johns Hopkins?
I don't know the number of days. All I know, I wasn't feeling well.
Okay. Well, let me show you 2529-5, and I'll represent that that was taken on or about the 7th or 8th. Actually, it's got it down there.
The
yeah,
7th.
The 7th. All right, what's going on here?
I am in a bed at Johns Hopkins All Children's Hospital.
All right, and did you walk into Johns Hopkins on this visit?
I believe I was able to walk in on this day, but when I left, I was having extreme complications with walking to the point where I had to be wheeled out in a wheelchair.
Well, the jury needs to know how this came on. You just wake up one morning and bang, you were in extreme pain, or how did it start?
It wasn't like that. It was pretty gradual, but not in the sense that it took like 3 months until I had excruciating pain. It was day by day I noticed that there was a pain in my right leg that was just getting worse and worse.
So it started in your right leg?
Yes.
And did it stay in your right leg or move?
Unfortunately, it did move because I wasn't diagnosed for quite some time.
Did it move or start moving during this stay or after? In other words, during this, was it just in your right foot and leg at this point?
At this point, no. It had traveled to the left leg as well.
So about how long did that take for it to?
It would have been 3 days then.
And so there, they give you something. I know you were very young. Do you remember much about this day?
I'm sorry, I don't.
Well, they'll have those records. All right. So after this, now, did you go home or did you go to another hospital from there?
Well, after this day, I know I went home, but then I was at one point transferred to another hospital.
Was that the one back up in
Illinois?
Do you know if you went back to Johns Hopkins for a visit before you went to Lurie's or not?
I know I had been to Johns Hopkins a few times, but I don't. It's really hard for me to remember. I was 10. Every hospital was the same to me at that point.
Yeah, and the jury has the records. All right, so let's publish 2529-19 and tell us what's going on here.
This is after I got off the plane that I landed in Illinois. My dad had some of his old firefighter friends pick me up off the plane and transfer me in an ambulance. And then the chief, I believe, went to baggage claim and got my mom and I's luggage.
So his old firefighter buddies helped out.
Yeah.
Mm-hmm. Now, looking at this photo here, it doesn't look like you're having much fun. I hate to put words in your mouth. But do you recall any of this?
I remember it was a very difficult plane ride. I mean, I was trying to be respectful to all the passengers, but when you're in pain, it's just so hard to stay quiet.
All right. Well, by this point then, about how... this is what, a few weeks or a month after the onset?
Yes.
What happened with the pain? Did it stay the same? Did it decrease? Did it increase?
It had increased.
And where did it increase to physically? Were there any new places or the same?
There was new places. At this point, it was at my midsection, and it was, I don't know for certain, but I know it did transfer to my arms at some point. I just don't know the specific date.
When you say now midsection, explain a little bit more. Are you talking about your tummy or your abdomen? Where?
Yes, I'm talking about my stomach.
At this point, had you started to have problems with any digestion or going to the bathroom, or was that later?
Yes, I had constipation issues, and we later found out that it corresponded to my diagnosis of CRPS.
And what happens there with those going to the bathroom issues?
Do you mean like how CRPS is connected to it, or just
physically, how did it manifest? What was the problem there for you?
I was just constipated, and when Miralax didn't work, we had to go to the hospital.
So did this start right off the bat once you had the pain in the midsection?
Yes. Yeah, I did have constipation.
Was it fairly consistent throughout your various stays at Johns Hopkins? You had this problem in the midsection where you'd get stopped up?
Yes.
Okay. All right. So do you recall what they did for you there at Lurie's?
I know that they suggested an intensive physical therapy program, but they also missed the diagnosis of CRPS.
All right. So they didn't, at this point, did you know what was really causing your pain?
No one knew.
And what was the effect on your mom and dad not knowing? Here you are a month or so after it manifested, it came on. How did it affect them?
Well, my parents were extremely worried, and in turn that made me more anxious because as a kid you look up to your parents for the answers. And then when they look up to the doctors for the answers and they don't even have them, you're just so unbelievably anxious.
So you came back home then, I guess?
Yes.
And did you go to another hospital after that?
Yes, my parents had taken the suggestion from the Illinois hospital, and we went to an intensive physical therapy program at Tampa General.
About how long was it from Lurie's, the hospital in Chicago, to when you went up to Tampa General?
I'm sorry, I don't know the dates.
The same summer period, or?
Oh yeah, it was the same. Mm-hmm.
Okay. All right. And how was your pain doing at this point?
My pain was still pretty bad.
Had anybody approached you at this point at Lurie's and said anything about this just being all in your head, or was that? Did you know anything about that, or was this just something you found out later?
I found that out later.
Okay. And was it in your head?
No.
Okay. So let's talk about and publish 2529-23. Okay, and where is this?
This is in the PT room at Tampa General Hospital.
And what are they having you do there?
This is a machine that is intended to strengthen your arm muscles.
Okay. How many hours of PT were you doing a day there at this time, if you recall?
I don't know the number of hours, but I remember Marissa, the physical therapist, because it's an intensive program, the PT, I believe, was like 2 to 3 times a day.
And what did they tell you about why you had to do the PT?
Well, none of the doctors knew what was wrong with me at the time, so they just assumed that strengthening my muscles would maybe help get me to walking again.
Mm-hmm. All right. Now, the space you're making here, does that fairly and accurately represent you in pain?
Yes, I'm trying to smile here, but unfortunately I was still experiencing a lot of pain.
Well, had it traveled up to your legs? To your arms at this point? Or?
At this point, yes.
Had you manifested any other symptoms? Now, looking back, not that you knew at the time, during this stay, if you know.
I can't say for certain, but I believe I started seeing some lesions, and I was very sensitive to touch. I know that for sure.
So how was PT for you at Tampa General?
It was very challenging. It's excruciating.
Mm-hmm. And was Miss Marissa, who testified here, nice to you?
She was lovely, yes.
All right. And were you outpatient or inpatient?
I was inpatient, yeah.
So you stayed there?
Yes.
And you remember for about how long?
A month.
All right. Now here, were your parents allowed to stay with you?
Yes.
All right. And let's then publish 2529-34 and ask about this. All right. Now, is that Marissa there in the green?
In the green, that is Marissa.
And what's that on your feet? What are you doing there?
So that machine is for pedaling, again, just in hopes of strengthening my leg muscles.
Now, at this point, a couple months maybe past when it came on, it looks like you still have some pretty good muscle mass in your legs.
Yes, and then I don't know if you could really tell, but you could see that my dystonia is starting to get worse.
Uh-huh. That means your toes pointing in?
Correct.
Tell the jury about that. There were allegations that you somehow made this up. Did you have any control over your feet when they started to go into that position?
I had absolutely no control over that.
What did it feel like when they began turning in?
It was extremely painful, and it was like tense, if that makes sense.
Mm-hmm. All right. Who's that person behind you?
That is Bonnie Rice. I kind of call her like the Kathy Beatty of Tampa General. She was a nurse, but overstepped in many ways.
So she followed you around?
Yes.
And she wasn't quite as nice as Marissa?
Definitely not.
Mm-hmm. Why did they have a nurse following you around everywhere?
Subject to the situation, Your Honor.
She knows.
Sustain when she re-asked.
What, if anything, do you know about why Bonnie Rice was following you around here?
I had the understanding that Bonnie Rice, even though she was a nurse, she believed that I had either conversion disorder, so I was like making up my disease. I don't know what child would want to pretend not being able to walk and not being able to play with their friends, but she drew that conclusion. She also had some problems with my mom because she expressed these concerns to my mom. My mom knew I was not making this up. She knew her daughter.
So wherever you went, there was Bonnie Rice?
Yes.
So eventually, and at this point, were you completely in a wheelchair?
Yes.
Okay. And so then, did you even have to go to school? Once you got out of there, did you have to go to school in a wheelchair?
I did visit my school in a wheelchair for the lemonade stand fundraiser they had for me.
Okay, let's publish 2529-39 and we'll come back to TGH. Now, what's this?
This is the school bus that had the lift so I could be brought to school in my wheelchair.
Okay, and this, it looks like it's September 21st, 2015. Was this after TGH?
To my understanding, yes, I believe so.
Okay, well, let's, or maybe it was before. Let's go back to TGH. Now let's publish 2529-41. Now what's that?
That is a CRPS lesion.
Right. And tell the jury how do you identify that?
Well, at the time, I still didn't know I had CRPS. Nobody did. So I started getting these open sores on my body, and I was very concerned because it's something I've never had before. And they're very painful, especially when you touch them.
Mm-hmm. And did they hurt?
Extremely, yes.
To the touch or just whatever you did?
When you put touch on them, it amplified the pain.
And so let's look at 2661. Now this is a video, and I'm going to ask you after this, what's significant about, first, was this after TGH?
I don't know what day, oh.
All right. So after this, I want you to tell the jury what's significant about this, and the date on it, I believe, is sometime September of, again, 2015. I only counted one note off. Now, to those that I guess play piano or not, what was happening with your legs?
Okay, so to people, you probably don't notice this if you're not a pianist, but there is a distinct sound when the pedals are being pressed. At this point, I was not able to press the pedals even though the song called for it. So I had severe dystonia, and that limited me from being able to do that.
Were you, obviously you're able to play piano, were you able to do any of the activities that you had before? Or?
Other than piano, I was not, because all of them required me to stand and walk and jump.
Okay. Now, here we are in September of 2015, and you're in a wheelchair. What other signs, what if any other signs of or symptoms of CRPS did you note at this time?
At this time, I was twitching. I had the allodynia, dystonia, lesions. There was the temperature changes in my limbs that we started to notice.
Tell the jury about the temperature changes. Why is this any different than just being chilly or it being too hot or too cold? Turn up the air conditioning or down the air conditioning.
Because it happens at random times and it's not influenced by external temperature. It's all internally happening. And then another thing that was weird that started happening is I would sweat in different areas, but not all over my body.
What areas, if you recall?
The back of my neck, and then lower back. I don't remember all of them, but those are the two that I specifically remember.
And were these dependent on whether you were cold or the exterior temperatures at all?
No, they were not dependent on the external environment.
Well, what else? Anything with the ears or eyes?
I did have tinnitus, which is just ringing in the ears, which I've never had before. And then with my eyesight, at this point, it was okay.
All right. And, okay, so your eyes are all right. So, through this period of time, did you get to see Dr. Wassenaar?
Yes, I did.
And he couldn't figure out what was wrong yet either?
No.
All right. So then did there come a time when somebody did know what was wrong with you?
Yes.
All right. If we could publish a video of 2666, and then you'll tell us if about this in a moment.
That doesn't feel good when I touch your legs, right? Or your tummy, when I touch your tummy, that feels good, right?
All right. Now, were you in distress there?
Yes.
Was that the kind of reaction you would get sometimes when people would touch your legs?
Yes, it's just from the allodynia.
All right. So the jury wants to know if you have this effect when someone touches your legs, how are you able to deal with blankets being pulled over, clothes being put on, any of the usual things you do if you have this reaction?
A common misconception with CRPS is that all of the symptoms from the beginning to whenever you have it, they're constant and then they stay that way. But in reality, symptoms can change on a day-to-day basis.
So sometimes you, like we saw in the video, you'd have the blankets off of you and sometimes on?
Yes.
Depending on the day?
Correct.
Was this frustrating?
It was. It was annoying to constantly have to tell people to help you with certain things, especially with the temperature changes, because you want to be comfortable, and here you're asking people to change either this thermostat or help you with blankets or help you change into something else, and you know you can't do it for yourself, so you just feel like an inconvenience.
Yeah. Have you always been a pretty independent person?
Oh, yes.
Did your mom want you to be that way, independent, able to handle things on your own?
Yes.
Okay. Do you know how, just if you know, you got to Dr. Kirkpatrick from the prior doctors you'd seen?
I do know the story.
Okay. Tell the jury how you ended up at Dr. Kirkpatrick's, and then we'll show, I think we can bring up a photo, 2529-42, and if you could just tell them what happened, how you got there.
Yes, so my mom was an infusion nurse during this entire time, and while I was at Tampa General, Bonnie Rice, the nurse I told you about earlier, she had a phone conversation with my mom, and that's when Bonnie said that she thinks that I was making up my condition. My mom told her, no, there's no way. My mom listed all the symptoms I was having and said, how can she be faking these? My mom went back into the room to treat her patient, and he said, I'm sorry,
I respectfully object to the hearsay.
What did she say next?
Objection to the hearsay.
Who said next?
What did, strike it, how did you know that Dr. Kirkpatrick might have some answers without telling us what somebody told you?
I know from the person who told us. I mean, that's how we found him.
Oh, sure.
So,
who suggested it?
It was the patient of my mom, Dave, because he has a daughter with CRPS.
So a dad of another girl that had CRPS?
Yes.
Suggested?
Correct.
Now, so you went in and saw Dr. Kirkpatrick?
Yes.
And tell the jury what he did in order to determine what was going on.
He had a very lengthy examination of me, and it included multiple different tests, and he took all the data, and then he said that my symptoms and my condition aligns with CRPS.
Did he explain about the Budapest criteria?
He did.
Mm-hmm. And so what types of symptoms did you show in front of him, if you recall?
I believe he did a temperature test of my extremities. He noted certain lesions I had. You could see one on my right arm. And then I had extreme sensitivity to light. It's just with CRPS, the nerves are hypersensitive. I also had dystonia at the time. I believe at that appointment there was no there was no signs of sweating, abnormal sweating, but again, that's just every day is different.
What's up with the sunglasses? Why the sunglasses?
I was sensitive to light, and that's just because the nerves in CRPS patients are hypersensitive. Mm-hmm. And then another, obviously the big giveaway that I had CRPS was the burning pain.
Mm-hmm. And the feet turning in there, that's the dystonia he noted?
Yes.
Mm-hmm. And about how long did he have you over there to examine you?
It was quite a few hours. It wasn't like in and out like other doctors' offices.
Mm-hmm. And did Dr. Kirkpatrick keep you in the mix about what he was doing and why?
Yes, he always told me what he was going to be doing, the certain tests. He asked me if I was comfortable, uncomfortable. He listened to me.
All right, now this photograph is dated, I think, down there in the bottom left, is October 5th, 2015. Had you seen him before this visit?
I'm not sure what day I saw him, but I know that he had an examination of me, and then the next time I went in, after trying pool therapy, we tried out the ketamine infusion.
Okay, so important to know, did Dr. K immediately go to ketamine, or did he have another therapy he thought might work?
No, he wanted me to try the non-medicative route first, which we did.
Mm-hmm. And what was that non-medicated route?
It was warm water therapy. My dad had bought a system to heat our pool. So I think like 10 out of 12 months of the year it's warm. Mm-hmm. So I was able to practice my therapy in there and try to gain some strength.
And did you try hard at that?
Yes.
How'd it do?
It helped a little bit, but it was not the improvement that Dr. Kirkpatrick was hoping for, or any of us were hoping for. So he decided it would be best to try the ketamine infusion.
In terms of physical therapy now, well, let's talk about what you had already been through at the different places at Tampa General and so forth. Had you had physical therapy so far?
Yes.
By this point? Had you had, I guess, occupational therapy, upper body stuff?
Yes.
And had you had some psychological evaluations?
Yes, I had counseling. Mhm.
And did you then have warm water therapy?
Yes.
And what kind of meds had they put you on up to this point of the ketamine? What were you taking?
I'm going to be honest, I was, again, like really young, so I didn't ask what medication I was taking. But it's my understanding I did try some prescribed opioids from my doctors.
Remember anything about whether they worked or not?
They didn't.
All right. So you'd been through physical therapy, occupational therapy, psychotherapy, warm water therapy, opioids. Now you were trying ketamine?
Yes.
Tell the jury how that went.
The ketamine infusion?
Mm-hmm. Yes.
So
Have we put in 252942? Is that already up? All right. Go ahead and explain what.
So the ketamine infusions were very different than anything I had tried previously. It's this like really small room with a bunch of different equipment and then a nice soft bed. And then super adjacent to the bed is like a little TV so the patients can watch whatever they want while they're getting the infusion. I slept for most of it, so I don't really know the duration of the whole treatment, but I know it was over the course of a few days.
Well, you said you slept during most of it. How were you sleeping at night at this point?
Oh, I was not sleeping. It's very difficult to sleep when, you're having excruciating pain and pain that you've never felt before.
And so, even with your high pain tolerance, describe for the jury as best you can so they can understand what it's like, the CRPS pain.
How I describe it to people who don't have CRPS, it's like I was born with gasoline deep within my body, and some incident, whether it was that sprained ankle or the severe asthma attack, was like a match and acted as a catalyst that just set my body on fire, and I have to live with this burning pain.
Mm-hmm. All right. And so how many of these, strike that, during the time at TGH, did you also have physical appliances applied to your legs and ankles to see if that would straighten out some of your symptoms?
Unfortunately, yes.
Tell the jury about those, in addition to physical therapy, occupational therapy, psychotherapy, warm water therapy, opioids.
So with CRPS, you have to be very careful with the type of therapies that you provide. And with physical therapy, you have to be especially gentle. Now, I was put into an intensive physical therapy program, and again, at the time, we didn't know I had CRPS, so we didn't know that it was actually doing more damage than good. One of the doctors noticed that my dystonia was getting extremely severe as my stay went on. He suggested that he breaks my feet, have a corrective surgery to straighten them out.
Let's publish 2529-35.
And that was Dr. Kornberg. I remember his name.
Okay. All right. So are those the corrective boots you wore?
Yes, so this was like part one of his plan. He wanted to see if the boots would straighten my feet out, and if it didn't, he was going to resort immediately to surgery.
Now, I can't quite see your mouth there, but what are you feeling there in that facial gesture?
Forcing my feet to immediately go from, completely turned in to straight was an awful idea. It was extremely painful. I remember just crying and crying.
And did your mom want you to try it, though?
She did. She knew it was hurting me, but again, at the time, we didn't know what was going on, so she was just listening to the doctors.
So the jury knows, did your mom ever push you to do any of these treatments, or was this something that you wanted to try too?
I also wanted to try it because I had my trust invested in the doctors. I thought they knew what they were doing.
Through this entire period of time, were you ever pushed by your parents to continue a therapy that wasn't beneficial, or strike that? were you ever pressured to do any types of therapies or things that maybe you already knew didn't work?
No, if we figured out that it didn't work, they were okay with listening to me and not going on with it.
Okay. So how many of the ketamine therapies do you recall having for this with Dr. K?
So after Tampa General, I had, I believe, one, like, not like a single treatment, but because it spanned over a couple of days, but itself, it was just like one session, if that makes sense.
Okay. Now, at this point, if you can recall, I think we have a video, I don't know if we'll see it, but can you show the jury about how high you could raise your arm going into all of this? Can you demonstrate about how high you could get it?
Yeah, at Dr. K's, I believe I told you about the examination, and part of his examination was like a physical, like, range of motion examination. I was only able to lift my hand to about ear level, nothing past that because of the pain.
All right, and so then after that, how did the ketamine therapies do for you? The ones at Dr. K's?
At Dr. Kirkpatrick's office, the ketamine definitely helped. It had helped me more than any of the previous therapies I've tried. So I wanted to stick with that in addition to trying the warm water therapy and continuing going to counseling. But ultimately, Kirkpatrick noticed that his treatments weren't going to get me to where he wanted me to be. So he brought on another doctor.
Okay. And were you continuing the warm water therapies when you were doing the ketamine?
Yes.
How did the ketamine affect your ability to do physical therapy?
Well, obviously I couldn't do it like immediately after. It's a new drug and I did have some side effects. I was a little bit confused coming out of it, but the confusion doesn't last long. By the end of the day, I was talking in my normal self.
But could you do more warm water physical therapy using the ketamine as without it?
Yes.
And why was that?
It's just because it alleviates my pain. I mean, for the first time, something is actually helping lower that burning pain. So I wanted to try even harder in physical therapy.
How did it feel finally having a diagnosis that made sense?
Obviously, the diagnosis itself isn't great, but it's nice knowing what it is so you can develop a course of action to try to tackle it.
Did your mom, best of what you remember, start researching what CRPS was?
Yes. So my mom, she was an infusion nurse, and she's pretty familiar in the medical field. So naturally, she wanted to learn all about it herself.
In terms of the medical analysis, if you will, for you, between your mom and dad, who would take the lead?
My mom did because that was her field of expertise.
Okay. So your mom was kind of your home physician or home nurse?
Sure, yeah.
And she was teaching you Polish?
Mm-hmm.
And would she take you to different events and places, drive you places?
Yes.
And was she helping you with your piano?
Yes.
And was she helping you through ballet?
Yes.
Okay. Did you have a good relationship with your mom through this?
Yes, I always did.
How about the fact that she wanted you to try some of these therapies that were hurting you? Did that harm the relationship? Or?
No, it didn't, because again, you have to remember before we went to Dr. Kirkpatrick, we didn't know what it was. So I think her willingness to try everything was actually a sign of love.
How did your dad react to finally hearing that this was CRPS? I mean, mixed. Or...
I mean, no parent wants their kid to have like a chronic illness. So they were sad, but I think at the same time they were just happy to hear a definite answer.
And how did they react to you telling them that after these ketamine infusions that it helped?
They were so happy to know that, something was helping. Finally, like one thing we try is actually doing something for me.
And up to this point, could they do anything for you when the pain would be at its worst? Was there anything they could give you or do for you that would affect it?
Before this, no, not at all. I mean, I remember laying in bed and just crying, and I have this memory of my dad. He took my monkey. You'll probably see it in a bunch of pictures, but he would take the hand of the monkey and rub it on my forehead until I fell asleep.
Mm-hmm. And were you sleeping? Tell us the sleeping arrangement once this got really bad.
Once my pain was to the point where I was just crying and screaming throughout the entire night, well, the way our house is arranged, first off, is I'm on the opposite side of the house, and then there's my brother's room right across from mine, and then the other side is my parents' room. So I couldn't walk to go and tell them when I needed help going to use the restroom, so we implemented a walkie-talkie system. It sounds silly, but I didn't have a phone at the time, so I would talk back and forth to them so they could help me in the middle of the night.
Could you tell how it was affecting your folks that their little girl was moaning all night in pain?
I try to keep it in as much as possible because...
Did they appear to be under some stress?
Yeah, they were definitely stressed out. And
how about Kyle?
Oh, for sure. I mean, we used to play together all the time.
Were you and your brother close?
Yes, we were. Even when we were really little, we had a very good relationship.
It's like you're the big sister?
Yeah.
Okay. How far apart are you two?
We are 18 months.
Mm-hmm. Right.
And then we do have an older sister as well.
That's right, Corrine?
Yes.
How much older is she?
I think she's 16 years older than me.
Okay. And were you close? Are you close with her?
Yes.
How was Kyle reacting to hearing his big sister in this kind of pain?
Well, my parents tried to keep him out of the loop when we didn't know what it was because you don't want to worry your other child as well. But obviously he knew something was wrong. I wasn't walking, I wasn't playing, wasn't laughing as much. I didn't go outside because I couldn't. So I believe he tried his best to distract himself with the neighborhood kids playing football and whatnot. But he was heartbroken.
Yeah. And so for you, was it difficult to see the other kids outside playing and you in the wheelchair?
Yes, very much so. There's actually one day I was invited to the YMCA, which is where I used to do gymnastics. And I was wheelchair bound at the time. And I never went back to watch them because it just ate me up.
Do you want to get out of that wheelchair?
Yes.
All right. So now, we've tried this, and how long approximately would Dr. Kirkpatrick's ketamine therapy benefits last? After you stopped, how long would it be before the pain would come back?
I would say, I don't know the exact days. I really didn't keep track as a kid, but I believe like maybe a week and a couple of days, but it just didn't last as long as we hoped.
Mm-hmm. All right, so did he make a referral then to try a different approach?
Yes, he did.
And where did he send you?
He called Dr. Cantu. He's a doctor in Monterrey, Mexico, and I went there.
You remember that?
I do, yes.
You remember the hotel you stayed at?
I do. I remember pretty much everything about the trip except the 5 days when I was sleeping.
Okay. And so leading up to it now, did you have some conferences with Dr. Cantu about what was going to happen?
Actually, I had a discussion with Dr. Kirkpatrick first. He explained some of the risks associated with the ketamine-induced sedation, the prolonged sedation. And then when I went to Monterrey, Mexico, I was then again told about the risks.
And how did it strike you? I know you were only, had you turned 10, I guess, by this point?
Yes, in December.
Yeah, because your birthday is when in?
December 10th.
Okay. So what was your reaction, from what you recall on your age at that time, to hearing that there were some possible complications, some possible risks with this procedure?
Well, I was presented with the worst case scenario, which was a 50% chance of death. Even though that's not completely true, they always give you the worst case scenario just in case something bad happens.
Had you heard that with other medications and things?
Yeah, I mean, every medication has like a ton of side effects. But you know it's bad when like a 10-year-old is willing to take that risk. I mean, that's how bad my pain was.
So the hotel you were staying at, was it fairly close to Dr. Cantu's office?
Yes.
And so then you, at this point, were displaying pretty prominent CRPS symptoms.
Yes.
Let's publish 2529-58. Record reflect, this is November 18th, 2015 in Mexico. All right. Tell the jury what's going on here. What are these?
These are CRPS lesions.
And now, what's the deal between the round one and the one that's a line? Although, if we can we go any closer on that to see?
So, to the naked eye, it kind of looks like a scratch, but in reality, with CRPS, sometimes these lesions do present like that, but they're actually connected.
All right, and so down there, right above the green band, I mean, is that another lesion there right off of it?
Yes.
Okay. And were you seeing more of these?
I was.
And what was your worry? I mean, had you, I realize you were only 10, had you read up on CRPS?
I personally did not read up on it, but I knew other people who had it.
Tell us how you knew other people who had it.
So there's actually this, well, she used to live in Mexico. She had CRPS really bad. She had it when she was a kid. She went into remission for a couple of years, actually, and then she got bit.
Your Honor, I apologize for interrupting the current discussion. I do object to this line of questioning.
About her having a friend? May I ask her about the friend?
Let's move on to your next question.
So you had friends down there?
Yeah.
And had it come to your attention from various sources that CRPS could take your life?
Yes.
Had you seen examples of that?
Unfortunately.
Okay. And had you seen examples of it going into remission and then coming back?
Yes.
So let's publish 2529-60. The record reflects this is in Mexico, November 19th, 2015. More examples of lesions, is that right?
Correct.
And where are these?
These are on my ankle.
Do you have any lesions right now?
I do have a few on my leg. My right leg, that is.
All right. So then let's publish 2529-61, looking at symptoms. Now here, although obviously you, were you unconscious at this point in this picture?
Yes.
And why is that significant in light of different allegations people were making against you at Johns Hopkins?
Well, because when you're unconscious, you don't really have control over your body movements. So my feet still being in that fixed position, like pointing inwards, shows that I was not making this up.
All right. And so you, knowing about the risk, you and your parents, did you talk about whether you wanted to do this?
Yes, they specifically asked me, and I know I was really young at the time, but they gave me pretty much full authority of whether I was going to go through with the like prolonged sedation or not.
Have you always been pretty mature for your age?
Yes.
I mean, at least in these ways, analysis and so forth.
Mm-hmm.
You were aware of your body and how to take care of yourself.
Yes.
I object to the leading, Your Honor.
Overruled. All right, so then let's publish 2529-69, and I want you to tell the jury a little bit about your relationship with Dr. Cantu. Is that Dr. Cantu who came and testified here?
Yes. He is so nice. He was, I mean, in addition to Dr. Kirkpatrick, he was one of the very few doctors who really listened to me.
Mm-hmm. And did he speak mostly English to you or Spanish? What?
Well, to us, he spoke English, but when we couldn't really communicate with him because we didn't know Spanish, my friend, the one with CRPS, Jessica, her mom, she spoke both language fluently, so she helped translate certain things for us.
Okay. And did Dr. Cantu tell you about this procedure that you were going to go into?
Yes.
Okay. Now, behind you there is a photograph of another patient, I think, next to you.
Yes.
Was that another CRPS patient?
Your Honor, we objection in the HIPAA violation.
There's no, she's not in the picture.
In multiple cases about talking about other
Sustained.
patients.
All right. So did Dr. Cantu then go over with you the specifics of how this is going to go and any problems you might have from it?
Yes, he was very in depth.
And so you underwent the procedure. I want you to tell the jury what the procedure was like.
Well, I met with the team of people who are going to be taking care of me prior to going under. I talked to all of them and they explained what their role was in my care. So I trusted them and I understood what they were going to be doing. I was told about the potential side effects, what it might be like when I'm coming out of it. I was explained the risks. I got a full in-depth picture view of what was going to happen.
Now, was your mom aware of other CRPS, either studies or real people, where CRPS had gone into remission and then come back to cause their death?
Yes. Speculation, Your Honor.
Overruled.
Yes.
All right. So you, how long does the procedure last, this first procedure?
I believe it was 7 or 5 days. I think it was 5 or 7. I think it was like 5 days of the actual medication of ketamine, but then there was 2 days for me to like slowly come out of it.
Mm-hmm. And coming out of it, how were you doing?
I mean, it was a little scary. I had the tube taken out of my throat and I was coughing. I was a little confused about what was happening, but that all went away.
How long did it take for those symptoms or side effects, if you will, to subside?
I believe it was a day until I felt completely myself, but by the evening I was somewhat okay.
And when you say somewhat okay, you've just been through this procedure. How did you feel, Maya?
Oh, like as part of me, like physically, I was feeling incredible. I actually asked Dr. Cantu, I'm like, hey, could I try walking? And he told me I couldn't do that because I could potentially, go back to where I was. He said, just baby steps.
So you felt good enough to think you could get out of that wheelchair?
I wanted to try.
Okay. All right. And this procedure was under general anesthesia, is that right?
Correct.
So you were out.
Yes.
So you don't remember anything?
I don't remember anything at all.
Now, did Dr. Cantu recommend that you have a booster soon thereafter?
Yes.
And what did you understand why the booster was necessary?
I know that he had performed this procedure many other times, and it's pretty standard practice for a patient to return and get the booster just to help.
Okay. And that procedure, now, was that back completely under, intubated and completely under, or was that like the times you had it at Dr. Kirkpatrick's?
No, it was very similar to Dr. Kirkpatrick's.
So you were not unconscious in any way?
No.
And about how long did those procedures take?
Those were also a couple of hours. I remember taking a little nap, but again, it's just because of the sleeping problem.
Between the two procedures, did any of the symptoms come back briefly or to the point where you're concerned, or?
I honestly don't remember. I know I was doing very well after the prolonged sedation. I think, again, it's just like pretty standard to get a booster.
Sure. All right. And then you headed home.
Yes.
So how did you do that first 30 days after this long-term ketamine procedure? Tell the jury what happened physically in terms of the pain and all of these symptoms and effects that you had from CRPS.
I felt significantly better. My dystonia was much better. My feet were almost straight on certain days. And just generally, they were like significantly like better. I mean, just straighter and everything. My pain was much lower, and then my lesions had almost completely healed.
And we'll see some photos on that. Your Honor, I'm going to break into another section. Do you want me to continue on, or do you want to?
I think we keep going.
Sure. All right. Returning from Mexico, let's look at 2530-3. And so this is, it looks like December 24th, Christmas Eve?
Yes.
2015. So were you out of the wheelchair?
No, I was still in the wheelchair, but if you look at my arm, the lesions are a lot less prevalent.
Mm-hmm.
And then my feet generally look a lot straighter. There was some dystonia still.
Can we focus in on the feet there? Okay. All right, there's a couple of black dots there. What are those? Are those?
Those are just healing lesions.
All right, but they were not active?
No.
Mm-hmm. All right. And I notice you're smiling here. Is that simply because of the Mickey Mouse ears, or are there other reasons?
No, I was just a happier kid in general because my pain was, I had some relief finally. And my mom and my brother were not in Mexico for the booster treatment, so I was happy to see them.
Mm-hmm. Okay. Let's then publish 2530-6 and ask you whether you were getting strong enough to do some energetic playing in the pool.
Most definitely. So at Dr. Kirkpatrick's pre-coma, I said that I could lift my arm like ear level, and now it was above my head. Mm-hmm. And I could handle my brother touching my legs here, and my feet are much straighter.
Mm-hmm. And that's December 28th, almost the end of the year.
Yep.
Okay. Then let's publish 2686. See how you're doing even a week later.
Cute girls. Really cute. Got it.
Who's that? Was that your friend from Chicago?
Yes. She had come to visit me, and it was perfect timing because I was feeling a lot better than I had been.
Okay. And could you have moved your arms and legs like that before you had the infusions in Mexico?
There are some days where you could see some movement, but nothing like that.
All right. And then published 2530-27. Did the improvements continue for you?
Yes.
All right. And again, I see you're holding up your arms. Could you hold your arms up that high before the Mexico treatments?
No, I could not.
And I notice your legs there sitting sort of cross-legged. Did you sit cross-legged a lot?
Yeah, that was pretty typical for me. I don't know why, but when I was sitting in that position, there was some difference in my pain. It wasn't as dramatic as I would have liked it to be, but generally it made my pain less.
Was it the most comfortable position for you on sitting on things?
By far.
Okay. That eased some of the dystonia?
Yes.
All right. So let's then look at how you continue to improve. And did you continue to improve through the spring and summer?
Yes.
Okay. Let's publish 2691. And as we're doing it here now, your family likes to scuba dive?
Yes, that's a common
so we can
thing
see
in our family.
what's going on now. And what's that on your wrist?
That is a bracelet that my cousin Matthew Klein gifted to me.
Mm-hmm.
It says never give up, and that kind of became my motto.
Okay. Okay. All right, and the date on that, the record reflect, is April 30th, 2016. So you try to spend a lot of time in the pool?
Yes.
To strengthen up?
Mm-hmm.
That's the idea? And did your dad work with you a lot on the physical therapy?
Yes, kind of my whole family did. That was kind of cool about it because it was also like family bonding time.
All right, published 2530-41. And this is May. Now we're into May. Okay. And you got your legs, one leg crossed, sitting on the other. You're able to do that, obviously.
Yes.
And you're obviously capable of eating gummy bears.
Yeah.
All right. And did your brother feel better now seeing you able to do some things with him?
Oh, yeah, for sure.
Now, how did you get around on the floor? Did you have to get in your wheelchair to move from one spot to the other, or were you able to crawl, or what?
I was able to crawl a little bit, but I also used my wheelchair to get from like place to place if it was like longer distances and if the floor wasn't comfortable. Another significant thing was I was actually able to push my own wheelchair, so I had some independence in my movements.
And was that a happy making thing for you?
Oh yeah, I was extremely happy.
Gave you a little more freedom. All right. So through the course of the summer there, were you getting stronger and feeling better?
Yes.
All right. Was it always so, or did you have some ups and downs?
Ups and downs, which is kind of expected with CRPS.
All right. And so let's see. I would like to publish. Who back then was your favorite singer?
I loved Meghan Trainor.
Okay. Let's talk about how you were doing in July of 2016. If we'll play the clip, just 3600 to 47. It's a brief clip from, and you can tell us what you're doing here in a moment. At this point, did you have limited use of? Oh, here you go.
My apologies, counsel. What's the date of this, please?
This is July 28th, 2016. Yes, July 28th. No, let's see. The clip is 26:59 on July 28th, 2016. You're moving pretty good there, Maya.
Yes.
Okay, but still not out of the wheelchair.
No.
Were you hoping to get out of that wheelchair?
Yes, I was on the track to be getting out.
All right. And so when you had some periods where the pain would come back, was it as strong or was it less than what you'd expected, what you had experienced before the Mexico infusions?
It was less than what I experienced previous to the prolonged sedation in Mexico.
All right. But did you continue the ketamine program through the summer?
I did because it's what worked for me.
Okay. And so you would go back for sets when you needed them, and there were a lot of them at some points and none at others?
Right. It just depended on my condition.
Okay. Did you try with your folks, did you try other types of treatments?
Yes. So even though we established that the ketamine had worked for me, we learned about the hyperbaric chamber. So we gave that a shot.
And how is that supposed to work? If you know, if you don't know, it's okay. But
I really don't understand the whole thing, but I did try it.
But you were in a high oxygen environment for a while. Is that
that's all I know. I don't really know everything else.
You know why you wanted to, your folks and you wanted to try something different than the ketamine infusions?
Well, they were always open to new therapies. They weren't just exclusively going to use ketamine. So when they heard about some success with the hyperbaric oxygen treatment, they gave it a go.
And did they want you to try things that did not involve a medication?
Yes.
And so what about IVIG, the immune system stimulant? Did you try that?
I did try that, yes.
Briefly. And did that do any good?
I don't have much recollection of it being like substantial, but I know that it did help me because I was willing to do it again.
Okay. Now, Maya, you were, as the record reflects, okay, let's see. Yeah. Let's I want to show how you were doing then in June and July of 2016. And now that we get into the summer, I published 2530-46.
Yeah, so here you could see my feet flat on the ground, which was a huge step for me. I was very proud of myself. I'm holding myself up with my upper body strength, and my dystonia is not present in this picture. I was really close to walking.
Okay. And were you looking forward to walking?
Yes, yes.
Let's publish 2530-50. Was it important for you to be working your upper body here?
Yeah, so my goal was to strengthen my upper body enough to the point where I could hold myself up with a walker if my legs gave out at certain times, so I was still safe and would prevent injury. Even though it was painful, I pushed myself.
Okay. Now, continuing then through the summer, were you looking forward to getting out of that wheelchair?
Yes.
Tell the jury by August of 2016, did you believe you were going to be able to get out of that wheelchair?
By the fall, I truly believed it, and I wanted to go back to school, walking.
Now, did there come a time when you, all right, let's play 2659. Did your mom encourage you through these things? That's not it, is it?
Nope.
Let's continue, and then they'll get that straight. And it was your mom encouraging you on the walker, if we get to it. And my next question is, were your mom and dad encouraging you through this period of time to get better, get out of that wheelchair?
Always. They always were very positive around me.
So driving you to these different appointments and things, was that a pretty significant time commitment for them?
It was, and it was very difficult, but again, they wanted what was best for their children, and that included, helping me with my treatments.
Mm-hmm. All right. So, and we'll get back to that one video in a moment.
It's 2695.
All right. Then let's do 2695.
That's better. I love you. Now go down slowly.
Now, what's the goal there with the legs?
Go down slowly. Good job.
Sorry, I did not hear your question.
Good job. Very good. Excellent.
Mr. Anderson, I apologize again. Can you please tell me the date of the video?
July 28th, 2016.
Thank you, sir.
All right. So the goal here by this point, the end of July, was that by the middle of fall you were going to be out?
Yes.
Right. And then did there come a time when you wanted to avoid going back to school in a wheelchair?
Yeah, I was the only kid in a wheelchair, so I didn't want to be that kid going back to school.
How were you going? What was homebound?
So that's a program where the teachers will come to your house and actually give you instruction.
Okay. And did you like that? Did you like your teachers?
I love my teachers. I mean, the fact that they were willing to take time out of their day to come and teach me, it meant everything.
And could they work around your treatment schedules?
They did, yes.
What was your concern with going back to school insofar as your treatment schedules?
Well, I would be missing instruction. I probably would miss assignments and my grades would drop. And I really didn't want to jeopardize my education, so we tried a different route.
Okay. And did it trouble you quite a bit then that you were going to have to go back to school in your wheelchair?
Yes.
And what did that lead to?
It unfortunately led to a relapse.
All right. This is your first relapse since Mexico? Or
Yes.
Your first relapse ever, really?
Yeah.
Okay. So did you go back to Dr. Hannah to complete more of a ketamine infusion set?
Yes, I did. We went to him because it's less expensive compared to Kirkpatrick.
Okay. And through the course of this now, what were the symptoms that you were displaying insofar as your stomach? And remember we talked about before the intestines and so forth. What was going on in this relapse? Or strike it. What had returned?
So with CRPS, it's pretty well known that it could affect some organs, and for me, it affected my large intestine, so I often got pretty constipated. It's because both CRPS, it's an attack on the sympathetic nervous system, which also affects the digestive system. So I was pretty constipated regularly.
And from time to time, did you end up in an ER for the constipation that resulted?
Yes, when our remedies at home like Miralax didn't work, we were forced to go to the ER.
To get cleaned out. Gross,
correct.
but
Yeah.
yes. Okay. And then let's publish 2530-61. And for the record, this is October 6, 2016. How are you sleeping at this time, by the way? At home?
Wasn't sleeping very well at night, so I took the opportunity whenever I was tired to sleep. This is during one of my infusions at Dr. Hannah's, and I'm taking a nap.
Were these infusions painful for you by this point, or?
No, the infusions themselves were not painful.
Okay. All right, then.
Mr. Anderson, can I see the attorneys for a moment? I know we're a little early for lunch, but instead.
Alrighty, so we are going to pause here with her testimony, and we will continue tomorrow with some of Maya's testimony, in addition to a couple other testimonies, and then the closing and wrapping up of this trial. So as always, thank you guys for hanging out, and I'll see you guys tomorrow again around 1 p.m. EST. Thank you. Love hearing your guys' opinions, and see you tomorrow.